Oh, am I doing the intro?
If you want to this time. I did last time.
Welcome to episode 2 of Patient
Versus Doctor.
We might need to restart that one.
Hello. That was so funny. Okay. Hi guys, welcome back to Doctor versus
Patient.
Except she's the doctor. And apparently she's really scared to say that. I don't know why. She's scared to say that she's the doctor, but she is. So today we are going to touch base on a few topics, and we don't really have like a firm schedule on what we're going to talk about. We haven't really laid it out today as well as we did the last episode, which is funny because that was the pilot and this is the first episode, but that's fine. More get to know us. I think today would be a good time to cover chronic illness.
And the reality of the presentation.
Yeah, so I wanted to talk about a little bit of what's going on in my life, and we'll get on to Sara obviously another time. It's not today, because I'm selfish, just because she doesn't want to talk about it.
And today I'm choosing actively for the audience. Yeah, I think they should know. Today I'm actively choosing to be the doctor in the room and separate my patient case. We will talk about my patient case at another time. And it's just a good time for me to not put on a mask, but choose to show up in the doctor.
Right.
Yeah.
Okay.
So we'll chat about it later.
Yeah. Cool. So where do you want to start with chronic illnesses?
If we're talking about you as the perfect case, honestly, and my PT students know this too, the ones who have done their clinical rotations with me, I personally believe that Amaleigh is one of the premier prime cases for chronic pain. And the reason I say that is because from a clinical standpoint, I needed all of my clinicians, and especially my students, because I don't share my patients, I needed my students to see my patients with a certain lens. When they come in, and especially with Amaleigh's age, right? Especially with Amaleigh's age, and please pause me at any point if you think I'm off, okay? Mm-hmm. So with Amaleigh's presentation and her age and her appearance and her ability to literally move from sit to stand, get out of the car, walk around, hold herself in a certain posture, and keep a certain facial presentation, especially as a woman, that a lot of people would misdiagnose based on subjective assessment of their objective movement. So I just want to clarify for those, I'll take out the medical term, right? If we're just being honest and real, I would say, okay, I need you to look at what does this person present as? What do you think? What do you think they look at? Are they walking a certain way? Okay, yeah. Are they limping? No. Okay. Does she look like she's in pain? No. Okay, then continue. We've already assessed that literally from the moment that we see someone in the lobby, and I'm expecting my students to have already assessed their gait, as any good physical therapist would. This is baseline. We are watching you from the moment you get in the best kind of way, okay? And so we tell everybody, like, we see things, and I promise no one else does, so we don't make you guys feel judged in any way, shape, or form. But I can say, oh, the jaw is shifted here, the shoulder is shifted here, they have functional scoliosis. We start assessing in our heads potential co-diagnoses that we need to look at. Basically, labels, right? If I'm going down a file folder, I'm looking at, are they walking a certain way? Do they have something that helps them, right? A wheelchair, a walker. And if none of those are present, and they're not limping, and their facial presentation is fine, and you check their heart rate, you check their blood pressure, pupils dilated, those types of things. We're watching what we call parasympathetic, sympathetic response, and a little bit of autonomic nervous response. We'll get into that another time, but basically, how is their wiring showing up? And we're assessing all of that the entire time. And so I'm expecting my students to look at Amaleigh, all of that, before she ever sits down in the chair to talk about, hi, my name is, right? Yeah. I maybe have introduced myself at the door, and then we say, go ahead, right? Lead them back to the room. When the patient sits down, pause. Right then and there, my student should already have labeled all of these things and potentially have a working hypothesis of what is going on inside their bodies. here's where I pause, because looking at Amaleigh from the moment that I met her to when she sat down in my chair, I did not give any assumptions that she was not in pain. So I just challenged society, and I'm going to turn it to you, on how many times, because you've been a patient many times, you have seen many clinicians. Right then and there, where is the difference? Because I have my lens of Amaleigh. Okay, we'll get into that story. But from that point, how many times have you had a clinician walk you to, or a nurse walk you to a chair, and already they've made certain assumptions that this girl's not in pain. So I'll go ahead and give you what someone, if I was going to assume that she wasn't in pain because of pupils are not dilated, she's not using a walker, a wheelchair, she's not limping, her face is not in distress, her heart rate and her blood pressure, she's not, okay. If I don't see that, the generalist would assume, the generalist in the room, not a specialist, a generalist would assume she is not in pain. Look at her age, look at how poised she is, look at how beautiful Amaleigh is. Okay, no. And if she laughs, does someone in pain laugh?
Yeah.
Okay? No.
We don't ever laugh.
Okay? So I'm going to pause my fire, and I'm going to hold it off to the side, and you guys will see it light up. But because I do feel a certain way about this side of the spectrum. I think the side of the spectrum of, before I pass off this freaking baton to you, Amaleigh, the side of the spectrum where you have no idea what I feel in my body. And I put on a mask to get here today. I put on a mask to even walk into this building. And then the psyche behind that, I'm going to let you take it. But the assumptions, I think, are the most painful, and they make me mad.
Yeah.
And that's where you and I had, like, one of our biggest fire points. Right, and it was the convergence of, I realized what my colleagues had done to you. My colleagues who took the medical vow, where is my license? Where are my licenses? I have so many to decorate that space in the wall.
Yeah.
I have alphabet soup behind my name.
Yeah.
Within as deep as I can get in neuroscience and cognitive studies, as deep as I can get in anatomy and physiology, because the only other specialist, mind you, who we were told, the only other specialist in the room who will ever know the body, like a physical therapist will, is an orthopedic, okay, and they've got their subspecialty of the body to the nth degree. A neurosurgeon who to the nth degree. Then you've got to get the subspecialties, right? Mm-hmm. Then we can talk shop. But no one else will know the body like you do. So it's just, my world is black, white, and red. And I say this all the time. My world as a physical therapist is black, white, and red. Stay tuned for my book. So, black, white, and red.
It makes her really angry what happened to me, so...
This is that anger, and I'm gonna pass it off. My world is black, white, and red.
Yeah, we don't need to get too angry about it.
Sorry for the audience. Okay, we're happy.
Corn dogs. Yeah, it's something that I think
I have zero control over the rainbow. I don't have control.
And I'm not upset that you're mad, by the way. It lights me up inside that someone actually cares enough and cared enough in the moment of when I was crumbling. So I'll just get into, I guess, my journey as a person and how it led to you. So my whole life, I knew that something was different and wrong about me, but I could never pinpoint what it was. And I never connected the dots on the fact that I had all of these gastrointestinal issues. I had cyclic vomiting syndrome for 2 years, and if you don't know what that means, basically means I was vomiting every day, all day, until I'm passing out, until capillaries in my eyes are bursting because I am so exhausted from throwing up. And that happened for, at one point in time, 6 months in a row, when I got down to 76 pounds. And every time that I went to the hospital, it got worse. They eventually put me into a mental institution and force fed me, and the nurses would watch me eat every single meal, and they made me drink 2 protein shakes in between each meal. So 3 meals a day, 2 protein shakes in between each meal. So that's 4 protein shakes a day, because they were convinced that I had an eating disorder. And then every time the food would just come spewing out of me, and I was not bulimic or anorexic, it just came out. And they ended up discharging me and were like, she doesn't have an eating disorder. Is something else really wrong here? And like a gastro doctor needs to figure out what this is. Turns out I have gastroparesis, meaning that my stomach, it paralyzes sometimes and stops functioning, stops emptying into my small intestine. So then I'm creating alcohol in my small intestine. Basically ethanol is what my food is creating. And that is because I have Ehlers-Danlos syndrome. What Ehlers-Danlos syndrome is this is kind of my umbrella of what starts all of my issues. Ehlers-Danlos syndrome is a connective tissue disorder, and it affects every single part of your body. So you hear connective tissue and you think, okay, your joints. And that's the easiest thing. And that's something that even doctors that I see, like I went to an eye doctor the other day and they're like, oh, so you're just really flexible. It's like, it goes beyond that. It's the makeup of my brain is different. The way that my eyes are made are different. Every single part of your body is made out of collagen, and my collagen is technically defective, right? It's overly stretchy. Right? Like overly stretchy.
What else can you do, Amaleigh?
Yeah, right. I can do lots of tricks, but I have been told that I'm not allowed to do them anymore. But like I'm super flexible, is what I'm saying. But it's not flexible in the way that you think like a dancer is. Like it cracks, it makes noise at this point in my age because I do have osteoarthritis and osteoporosis in most of my joints. And so if you can imagine like your grandma stumbling around and she's got arthritis everywhere, like that's me, and I'm not even 28 years old yet. That's me. And I'm looking at getting a hip surgery. I've been waiting to get a hip surgery for 2 years, but I've been denied 3 times.
And mind you, all of the diagnoses that you were given, just so the audience knows.
Yeah.
Because I hear these words and I'm like, yeah, right? That makes sense. About the legitimacy of these diagnoses, because the legitimate diagnoses of osteoporosis, osteopenia, guys, these are based on black and white numbers. You either have it or you don't.
Yeah.
So what Amaleigh's saying is like in my medical world, it's like she's not fake. You can't fake osteoporosis.
No.
You can't fake.
It's on X-ray, unfortunately.
It's a number. It's a number. It's a picture that's equated to a number. There's a degree. It's literally radiology. This is black, white. Guys, this is baseline medical terminology. We are not talking super scientist in her terminology. I want you to understand that in the medical field, this is like, okay.
Yeah, osteopenia, osteoporosis, yeah.
And if we're being honest, on my side, when she says osteoporosis, osteopenia, like you go through these lists of diagnoses outside of the connective tissue.
Yeah.
Right? Outside of the connective tissue diagnosis, and I'll let her finish, I'll talk to you about how this person should present. Okay? How this person should present, or typically what changes, how does that osteoporosis, osteopenia walk in the door? How does, right? Mm-hmm. So continue, please. Yes.
Yeah.
Yes.
So to touch on that, osteoporosis, if you don't know, means bone loss. And so my most recent X-ray of my right hip is I have a femoral hump, so a cyst on the ball joint, right, that goes into your hip. Now, you could understand how that would cause me a lot of pain, and nobody ever told me that. I have to go through my own medical files to be like, interesting. I have permanent damage on my hip from constantly, that's what that is, that bone hump is created by a cyst, and that's caused by constant grinding because I dislocate my right hip all the time. And so what's keeping me from working right now is actually my left hip. I dislocate my left hip. So I'm used to using my left hip as my crutch. My left hip is my crutch. I use it for everything. My right hip is just, I can kick really high. I can like kick my nose if I wanted to with my right hip because it's just woo, like I could spin it around, you know. My left hip is my stability leg, and so that's why I am struggling more today, the past couple weeks, because I ended up dislocating it when I was walking down the stairs. I mean, that's how easy it is for people with EDS to dislocate something. I was just walking down the stairs, you know, and I come to work the next day for 2 days after I dislocated it, and my bosses are like, I'm crying at my desk, I'm like, whatever, just trying to move on with my day. My bosses are like, how did you dislocate your hip? And I'm like, just walking down the stairs. And they literally said to me, oh yeah, I forget you're fucked up like that. I forget that you're fucked up like that. And I'm like, well, honestly, I'm not even that worried about it. So I'm like, you know what? Thank you for recognizing it. Because most people don't even, I don't like that. I don't like it. But I like it more than somebody looking at me being like, you're fine. You're fine. You're fine. Don't worry about it. I'm like, I'm not crazy. I know I'm not crazy. Something is wrong. And I yelled that at doctors my whole life. I'm like, but what is this? What is this? What is this? And I have to tell them, like, I don't want pain medicine. I don't want opiates. I don't want them. I don't like them. Oh, turns out I'm allergic to most opiates. So I'm not an addict, by the way. They've literally tested me in the hospital to see if I was pain seeking. Tested my blood, and you can see it on my chart. If y'all don't have my chart, by the way, get my chart and look up all of what your doctors say about you. It's very interesting to see what they say.
And I don't know if hopefully this gets to friends outside, like the UK and other countries too. Hopefully we can translate that. But for my chart is what we call a piece of an EMR. An EMR is an electronic medical record file system. So imagine you go into the doctor back in the day, it would be a piece of paper, and it was based on what's the best for the doctors, the ones who are potentially getting sued, right? Like you go to the nth degree, what kind of legal coverage do they need to say that we did the left hip, we did the right hip, we did, there's a whole procedure that goes into that, and so it has to be the nth degree. Well, that's an electronic medical record system that's coded in a certain way. It's a computer system. It's a program. Within that, in America, we call that for the patient portal, how the patient sees these charts that are not handwritten anymore. They're through this computer system. My portal is where the patient can go access all of the documents, everything.
All of your blood work, not the discharge note, not the what's next note that they give you whenever they give you paperwork about your doctor's visit. This goes over everything they have to say about you.
And we call it note.
Like how you were talking about what you look like when you walk in. And it's very interesting to see the difference between my general physician, right? My primary care physician versus like my physical therapist. My physical therapist says that my gait is abnormal, right? My gait is how you walk, right? She says it's abnormal. PCP says normal.
PCP is primary care physician in America. Yeah,
primary care physician, normal. Gait is normal.
Yeah, and this is a PCP in America, just so you know.
Ambulating fine.
Yeah. So what Amalaigh's talking about.
Ambulating fine, but I have a million braces on me right now to get to this doctor's. I literally went to my last arts appointment 2 weeks ago. I had how many braces that I have just on my upper body? Like 3? And then one on my knee, and I was using a walker, and he said ambulating regularly.
Regularly? Okay, so I'm going to time out right there.
What is regular?
Also, on top of that, regular is not even, and again, this is what we have to document, and we're expected to document. What Amalaigh's talking about is like, oh my gosh, all these things. We call it a SOAP note. SOAP, like soap, like that you wash, right? And I don't know and so I'm really excited, like this summer to go actually do my abroad travels and experience physical therapy in other countries and other systems, right? And applying for the visa. So when I speak about this, I am speaking from a world view, not an American view, right? I've always considered myself a European physical therapist in the terms of the sling systems and patterns and how physical therapists are taught overseas. And even my fellowship is based out of the UK and Germany. Like when you look at my fellowship, it's based out of Europe, and it has a lot of heavy neuro base. So that's where my schooling comes from, which is unique. So my lens as a physical therapist, and I guess we'll show the picture, and I'm not trying to toot my own horn, but I just want you to understand, like, the way I saw Amaleigh from the moment she walked in is the subjective, my lens of her. So that's at the top of our note. And then we have an O, and then an A, and then a P. So what Amaleigh's experiencing from the moment that she walks into the end is the SOAP note. How do I subjectively see her? What are my objective findings? And that should be the black and white and red. And then the assessment, when I am testing her, this is positive, this is negative. It's black, white, and maybe something in between, but it's an objective number that we're going to watch for 8 weeks. How do you pick a timeline? At some point, we're expecting the patient to come back. So we have a she had a 4, right? We'll pick a number. She had a 4, but now she comes in and she's a 5, okay? I mean, we're looking for those assessment objective numbers, black and white. And then we're prepping ourselves to give us an objective measure for the next time they come in. So we have a metric of whether or not they're getting better, which is key for, I think, this diagnosis. And then the P is the plan of care. What is our game plan? What, like, this person comes in, we see them, these are the objective tests, this is my assessment, the assessment, sorry, I misspoke. The assessment is, like, the diagnosis on my part. Like, I believe that, right? We are saying that I believe that you have this because of this, this, and this. It's a summary of my subjective and objective assessment. And then the assessment is the overall, basically that final stamp. This is my summary, if you will, of this person. And then the P is the plan of care. How do we plan to move forward? What's our timeline? All of that. And so every single chart that you'll ever see, even if it's a surgery note in America, and I'm excited to see what the UK looks like, in America you will find some type of SOAP note. And so that's why we can communicate back and forth. And so I can send a note via a fax machine. And I can send a note to her other doctors.
Yeah.
And I have to. And I have to in America if we're using insurance and cash pay. Also, the communication is expected as well. That's more like American system type stuff. But to focus back on Amaleigh as the patient, this SOAP note is sent back and forth. So when we get a patient, before Amaleigh ever walks in the door, I've already heard and read about what someone else has seen her as, okay?
Yeah.
So if we go through insurance, right? If we're using insurance and not cash pay direct access, that's a different model. I've already had contact, and the only way, this is interesting, the only way that she can see me as a physical therapist using insurance-based, hospital-based system is they send through, typically it's easier if it's within the same hospital system, they fax us information and we're expected to read it before she ever walks in the door. Okay. But I challenge in the most loving sense of the word. I challenge you. Did you think that she was in pain from when the video started?
Yeah, I only give minor cues, I think. I think if you have a really, really keen eye for it, then you'll see it. Yeah. But it takes a big doctor to look at my chart, right, the SOAP notes, and because it goes over like blood pressure, what your skin looks like your skin. They're like skin tone is even and whatever. I'm like, oh, thank you, skincare. Like, no, but they talk about all this stuff, and it's so interesting to see what they fucking say about you. I'll be honest, it's crazy what they say about you, and that they categorize you as one type of person immediately from the second you walk in.
You have access to this, guys. You should legally. Yeah, you have access.
Legally, you have access to what they say about you, just so you know. And I think you'd be shocked. And I think that now they know.
Read it.
Now that they know that I read it, because I commented on something, because you can comment on it, and I found that out. You can comment and request diagnoses to be taken off. And so I requested that they take off, it was like severe anxiety disorder that my heart doctor put on my chart. And I'll get into that. But so, yeah, I mean, they say that I ambulate regularly. Ambulate meaning that you get around without a walker, which I do use a walker. And they say that my gait is normal, but then my physical therapist, who has a really keen eye for that, is like, no, you don't. Not her, not you, but you do too, probably same notes. But I think it takes a really big doctor to look at what this other doctor said about you, to then look at you and basically throw that SOAP note out the window and look at you just as they're seeing you. Because I'm assuming it would change your opinion off the bat. Like, you're going to have a bias towards me based off of the notes that you read about me already. Right? Like...
So, how does one... If you read, and there's options.
But it was an objective fact that I had to see you by my colorectal surgeon. My colorectal surgeon is the one that sent me to you. It was like, oh, well, you have levator-Ani syndrome, which is... What is levator-Ani syndrome?
Did they tell you what it was? Because that's so interesting.
Not really. They just told me they just wrote it down. And so it's just in my chart. And I'm like, I looked it up. And I know that it's like, has to do with your levator muscles, right? So basically I have an obstruction in my bowel. I don't know what that means. I know that it causes the shooting pain, that it feels like someone's stabbing me in the bowel. I think most women experience that during their periods, but I have it all the time.
Right. And that's what I want to get into, because the legislators, I just want people to know it's challenging from a pelvic floor women's health standpoint, that certain insurances, if I'm being honest, we have a hard time giving the diagnosis that we truly find as pelvic floor physical therapists, and then experiencing an insurance coverage of that. So this was really sad and I made sure my students knew this. I was like, they had to know there's certain pelvic floor diagnoses that I guarantee you that you have, but if it's literally, I had to edit full charts, and take off the actual diagnosis of the pelvic floor because the insurance refused to cover it.
Listen, Doc, I'd love to approve this, but your diagnosis appears a little accurate, if you know what I mean.
Why?
If that wasn't covered.
Levator Haney syndrome isn't covered?
There are certain diagnoses within this new, what we call ICD-10 and ICD-11, and like there's certain codes. The diagnoses, we get really specific with time, chronicity, and like more root, which I think the intent was all good, right? The intent was all good, hopefully. Mm-hmm. But because we made a new diagnosis coding system that then pulled you guys in different timelines, right? Kind of spread you out. Instead of just saying knee pain, it's not left knee pain anymore. It's left, and is this the first initial encounter? Did this happen kind of later in time? That kind of thing. Mm-hmm. Or was there an injury? And then we get the migraines have their own and headaches have their own. I mean, we were getting very specific, which is great, right? So hopefully the person can leave with a very, very specific diagnosis, and we're, as the clinicians, acknowledging a certain timeline. Hey, I see that this is acute. This just happened. I see this is subacute. It's been kind of around here and there. This is chronic. And chronic, by our definition, is more than 3 months. Okay?
Really?
More than 3 months. Chronic pain. Now, granted, I've been out of school a little bit. Okay? But just talking with some of my colleagues.
Wait, so what is it called if you've had it since you were literally 7 years old?
That's chronic.
How am I in the same category as somebody that's been experiencing knee pain for 3 months?
Good question.
That doesn't make sense.
Exactly.
Because obviously I'm going to act different than that because I've had to grow up and live my life in pain my whole life.
And that's where we get into the different splits. So ICD-10 wasn't specific enough because you are different. Yeah. So we had to make a whole new coding system.
No offense to anybody that's experienced chronic pain for more than 3 months. That is, I wish that on nobody.
Yeah.
But
yours actually is different. So the chronic pain is different. So we actually have a different code.
Okay. For
now, because you didn't exist before. Your type of chronic pain didn't exist in a coding system, if that makes sense. Yeah. And then we went to ICD 11. Which really got really specific, which is great, but then there were also some cons too. So we are realizing, and I think this is good for the medical system, to realize that there is a difference between different types of chronic pain. So there's acute on chronic, which kind of means like, hey guys, it's like a spiral staircase. Mm-hmm. Like it might look like she's going, and hope this is how I see acute on chronic. Okay, I see acute on chronic as Amaleigh. Amaleigh to me, when I see Amaleigh, if I could draw it, would be a spiral staircase. Amaleigh's going up. We're going up. It might look like she's doing circles. She's not getting any better. Okay? I don't see her like that. I've always seen her like this. Sometimes we might be on the same level for a little bit. We might go down a little bit. But ultimately, she's gonna go up. Yeah. She's gonna go up. And more of that, I think, is also your spirit. And I get to say, hey, I don't mind being the putty. I don't mind being the towel that makes sure the step is clean and it doesn't have water on it because the roof's a little leaky today. Sorry, we had some weather. I don't mind being the towel as a physical therapist. I don't. If it's for pain modulation, but if the patient chooses a more naturopathic route, I'm not going to give her medications. I can't give her that. I'm not going to give her surgery. I can't give her that. In my practice and the nature of physical therapy, we are the artists of the body. I'm not gonna change black, white, and red. but as my lens, I need to know that the rainbow exists, and this is where you get other doctors, right? And other diagnoses, because I'm not even going to ever diagnose you with anything. Truly. I can have a physical therapy assessment, and I can add things. But when we have our doctor talk, right, and I'm going back and forth with her docs, and we're chatting, right, because we got this lens, this group of people around her, right? We're all sitting at the round table. What is it? The Knights of the Round Table, right? King Arthur. King Arthur. I want to sit at the King Arthur table with her clinicians. And this is where she knows I get fiery. I'm not going to sit on a personal, professional, any level in life. I refuse to sit at a table where there's not kings and queens in the room. I don't need jokers. I don't need clinicians who have an ego trip. I want to sit at the table that knows that at the center of that table is Amaleigh. And that is every single one of my patients, and it's just because, like, that's my lens. That's who I am. Yeah. For anyone who knows me, and, like, I love fiercely, and that includes my tribe. So, and I recognize, and I hope the audience does too, that this is a very unique encounter. This is one once in a million.
But
because
I think it's out there.
It is. And I
think it's out there. I think what I hope to gain from this is we are very unique. I don't think that you should necessarily do this with all your doctors. That's probably unethical. But you don't treat me anymore, so I think it's fine.
Yeah. So that's a good point to make, and I think that's very healthy for the audience to know. There is a delineation, and we talked about it. We said at some point, like, she was like, let's go do this, let's go do that, and I was like, I'd really like to one day. You have to graduate from me. And I think at one point tears left your eyes because, and guys, I also, like, left that company, right? I had to, like, transfer Amaleigh, so I didn't leave her. I didn't say, like, you're discharged, you're gone, right?
Yeah.
It was a transfer. I was like, oh man, I gotta give my caseload to somebody, right? Like, and so that was hard for me to do. Because I don't trust easily. And we'll get into that why later, as a patient, stay tuned later. But, like, I transferred her care over because I had to leave. And so then it was a sad break, but then we took probably a couple years, at least a year or two. And at some point we reached out and we're like, hey, like,
it was only a year.
Was it a year? It felt like forever.
Yeah, it felt like forever to me too, but it was only a year where I didn't see you.
So we weren't, like, crossing that patient-doctor relationship. I think we talked about it at some point, like, hey, you're really cool, you know. We addressed the
we knew
friend chemistry in the room.
Yeah.
We
knew one day this would happen. We knew. We talked about it.
We can be honest. You can tell them.
Yeah. Like, no, we knew. I knew. At least.
Told me.
Yeah, I told you. I was like, you're my friend.
And this is happening.
You're my friend, and
I was like,
we're gonna talk about what we want to do in the future.
Right, and
we want to do podcasts, and we want to be on podcasts together. And you even told me one day, like, I just want a podcast. I want you to go on this podcast for this lady, like. Yep. Because I'm such an interesting case to everybody. Mm-hmm. I am the case that people, if they have students that are working under them, they bring them in the room and they're like, okay, so this is fun. Figure her out.
And that's not the first time. Like, it happened with me, but how many times has that happened to you?
So many times. My physical therapist, my heart doctor, like, everybody brings in, like, if they have a student working under them, they're like, you need to see this one. And the thing is that, so Ehlers-Danlos syndrome, we have a ribbon, and our ribbon is zebra, because in the medical field, did you know that about it? Yeah, we're zebras.
No, that makes sense.
Yes, because in the medical field, what they say when they're teaching you is if you hear hoofs on the ground, to expect horses, not zebras. Because the rare ones you're never going to see a rare one. You're never going to see a rare one. Don't even think about it. I know that you just learned all this information as a doctor, but you're never going to utilize that. You're never going to meet that. It's never going to be a zebra. Well, zebras do exist, and I am one, and I actually know many other zebras. Even before I got diagnosed, I realized, oh my God, my friend from elementary school, she has it. Oh my gosh, she got diagnosed too. Like a year before I did, and we had never talked about it before.
Yeah.
And we find each other, I think the people that are like me, I think we find each other. And they think that it's because we have a difference in our cerebellum, and it is linked to neurodivergency. But it is a disease that affects your heart, your liver, your stomach, every single part of your body. And so it's really interesting to me that even the people that are required to learn all this stuff just look at you and you're like, oh, you're just flexible. Great, I'm just flexible, but I have a potential to go blind. I have a potential to have my heart rupture.
What about fall down the stairs, Amaleigh, when you're only in your mid-20s? Yeah. You're fine.
Yeah. But yeah, I have the potential to have an aortic dissection. Like, that's nuts. The fact that my cornea could detach. The fact that my cornea can actually dislocate. Think about that. My cornea can dislocate. I never knew that. And I was like, that might be why sometimes I lose my vision. Like, completely black in one eye. And it might be because my cornea has moved. And I never knew any of these things about me. I never connected the dots. And I remember the day that and I don't know if you remember this as clearly, but I went to squat. I had been seeing you for about a year. And I went down to squat with a medicine ball, right? With a weighted medicine ball. And when I stood up, I almost passed out.
Yeah.
And then so she immediately put me on the table.
Yep.
And you used your stethoscope and the little reflex thing and you're like, yeah, your hips are separated. The sound isn't moving through. And also, you witnessed that day what is called a POTS attack. So, Ehlers-Danlos syndrome has a tendency, especially hypermobile type, which is I don't know if I addressed that. I have hypermobile type 3. That's what I have, so I'm a 9 out of 9 on the Baton score. The Baton score.
Find that, Amaleigh?
Huh?
Where do they go to find out this testing too? Keep going. Didn't you have to go to a place, right? Like, she doesn't go to her general doctor.
No.
What she called a PCP, and I don't know what they call it in the UK. But a generalist, like I said, a primary care physician will not have these tests. Will not even, it's like a toolkit, like if a doctor comes in with a toolkit, the first one that she's expected to see before she gets to see any of the other specialists, right? That was your experience. Not a pediatrician, which is also like the generalist who's kind of watching you. It's like the first one with the big global eyes on you. Then she has, as she gets past a certain age, or typically legal age 18, was it 18, 16?
I think it's 17.
You cannot see
adult doctors.
You cannot see your pediatrician anymore, the child specialist, right? Now you have to see a general physician, GP, PCP.
Or PCP, whatever you want to call it. It's internal medicine, whatever.
Yeah, well, internal medicine in our world, they're expected to look at you a lot more deeper. Which
I have a PCP and an internal medicine doctor. Yeah. And she put herself on my case, which is really interesting.
That's a good sign. That's round table.
I passed out at my doctor's office, and she came and checked on me before my PCP. She's the one that took care of me, because someone had to make the decision on whether or not I was going to go to the hospital or not. Because it's really scary whenever somebody just passes out. They were taking, like, my blood sugar, my blood pressure, and I then had to, when I came to, I was like, I just had POTS. And they're like, oh, okay. And so it no longer is an emergent situation to go to the hospital. But can you imagine how many times I went to the hospital in my life after passing out with a really high heart rate, really high blood pressure, and they look at you and you're like, you just have anxiety. Oh, so I'm crazy. And I truly believed it for a long time. But you witnessed that day a POTS attack. And you put the pieces together all on your own that, the way that she moved her hip and the fact that it's disjointed, right, that it's separated, that caused you to have elevated heart rate but low blood pressure, and then you were about to pass out.
Autonomic nervous
And I don't know, and I have an autonomic nervous dysfunction.
But her system screamed at me. Yeah. I want you guys to know, like, I would fail a student. You should have learned that before you walked in my door. As a student?
Yeah.
You think that I'm going to sign off on something that says I trust you with any patient in the future? Do you know what could have happened to her if they missed that? One squat. So I know. The answer is no. I would have failed you. Do I feel safe to sign off on a piece of paper that says, I trust you with future patients because I know you can see the red flags. I know you can see past her mask. I know you can see past this. Do you see her clearly? Yes or no? The answer is no if you missed it.
Yeah.
So, and it's basic. And I have failed. I have failed a student before.
Yeah.
Because I felt unsafe to sign off that I could hand my entire caseload to that student, not right then, Because Lord knows I wasn't handing off my whole caseload. I'm defensive of you guys. So,
Yeah.
especially of you, like that case. And the reason I'm defensive of Amaleigh is because as a clinician, do I feel like someday this student in front of me, who will be called doctor one day,
are they going to overlook me again?
are you going to see Amaleigh? And if the answer is no, and there's different versions of you, right? There's different
There's
versions.
lots of me.
So, there's many zebras.
Yeah, there's so many zebras, and they act like they don't exist, and they absolutely exist.
And even like on the animal level, if we're getting into zoology, I'm sure you know this, right?
What are you about to say? I don't know.
What is the genetic variation of a zebra? Where does it come from? Genetically, where does she come from? What does she look like? Her hooves might sound the same. Let's catch the differences. And if we're being honest, I do believe, because I got really interested in this. My mom had a Shetland pony growing up on the farm, right? Growing up on the farm, and it was named Don't Go, right? It was super tiny. But I was always curious about what is, like, if the zebra is so unique and it's a cross, it's a hybrid, right? Isn't it crossed between a donkey and a horse?
Kind of. I mean, they kind of grew separately.
But it's a hybrid, yeah?
Not really. You can hybridize them, but they're kind of their own.
Okay, they're their own unique line from
their ancestors of different horses,
Bred
zebras, and donkeys all come from the same line.
Okay.
I can't remember what they're called.
That you can
Zebras
create?
are their own.
Can you create a zebra?
No.
Guys, please note that I'm not a zoologist, and this is where I learned, and Amaleigh teaches me.
Yeah, no, you cannot most likely create a zebra, but you can crossbreed a horse and a zebra because genetically they're very similar.
That's it.
But you shouldn't because of the health implications.
That's it. What's the name? Is that a Zorse?
Yeah.
Zorse, that's what I was getting to, guys.
So the problems that they have
What
in their
happens?
joints are crazy because horse and zebra proportions are way different. And so they end up having really bad knees, really bad backs, and they end up they can never be the same. They never come out the same size. Even if you mix the same zebra from the same group of zebras, this whole like little tribe of zebras, no matter what, if you mix it with the same breed of horse,
Doesn't matter.
say you mix with an Arabian horse, no matter what, it's going to come out a different size. Just like Labradoodles. Labradoodles should not exist. I don't believe in Labradoodles existing. They always have horrible genetic issues, and they always come out different sizes. Even if you breed the same size lab and you breed the same size poodle, they always come out different sizes. Why? Because their genetics really shouldn't be crossed.
Wow.
They shouldn't be crossed. So no, you cannot create a zebra. I guess we could with science for sure.
A Zorse is what I was thinking of.
Right, which is different.
That makes sense because the genetic line is different. All that being said, guys, like...
But zebras have more of the temperament of a donkey, than a horse.
Yeah.
Because they are wild. They're completely wild. They will
Yeah.
kick the F out of you.
Yeah.
Very aggressive. Horse. They're like horses, but they're very aggressive. Like, imagine like a horse, like the most untamed, rude horse.
Yeah, and I think that it goes back to...
But they have to fight off lions, so like they have to be like that.
Yeah. I mean, I think it goes back to you're genetically different.
Yes.
A zebra, literally, like, a Zorse is the animal I was thinking of. But she's genetically different. Her genome, her genetic makeup, which is very, very easy to test, yes.
Yeah.
They just have to know where to go, right? And
You should know what to look for.
Or what doctor do you go to get this diagnosis, right? Because I'm not going to give it to her, but I saw a symptom that then screamed, autonomic nervous system, not okay, somebody help me, red flashing light.
Yeah.
One time,
and
by
you
the way.
put the pieces of the puzzle. Well, I think I felt faint before when I came in, but not. It wasn't like you didn't see it like that. Where like I moved my body wrong and then I'm gonna faint.
And I was gonna say it was a working diagnosis too, and we kind of had the conversation of like, how many times has this happened? Oh, I dislocate. Oh, I did like I'm stretchy, and I'm like, this is not good, right? Because I know I can't diagnose.
But here's the thing: I didn't even consider myself flexible anymore.
You didn't even see yourself as potential EDS.
No, never. I had never heard about it.
You didn't know it existed until I told you about it.
No, I had no idea what it was at all. I had never heard about it. So I didn't come up with this on my own. And that's what I had to explain to my PCP.
And I was like, this is screaming EDS.
Yeah.
This is screaming EDS.
Yeah. And so basically after that, she's like, I have someone I want you to talk to. and I'm going to make her talk to you probably like in the next week or two. I'm going to make her fit you into her schedule. I was like, okay. And then after that, that one wrong hip movement, whatever I did when I squatted, I squatted wrong, and apparently for my body. And that's what happened.
At the time, the weather was perfect.
It doesn't matter.
Right.
It doesn't matter.
It's the perfect storm.
Yeah, it happens to me out of the blue, and I've had issues with personal trainers because of this. It's like, well, this doesn't feel right. So I'm not gonna do the same posture that you want other people to have because I don't feel right, and I had to fight that, which is how I ended up coming to you in the first place. Was a personal trainer effed me up by making me do things I didn't want to do, which you should never do, by the way. Don't do something if it doesn't feel comfortable.
Which also, how long have you been working with that trainer?
A while.
So, heads up, guys, and I do work closely, and I just want the audience to know, like, I love my fellow clinicians. I can't do my job without them. I need a round table of
you like your kinesiologists.
Yes, I need other zoologists who see in the best way, right? To find zebras and care for the horses, care for the zores, care for all the things, right? Care for all the animals, right? The animal within, the lioness, the huntress heart. So I love my fellow clinicians because I have my lens, red, black, and white, and I love the other clinicians who have such a specialty and a desire to find and see the rainbow. I know that they'll see you clearly. We see you clearly, okay? We see her and every other patient the same way. And we can communicate openly. There's a good relationship, whether it's a chiropractor, a personal trainer, PCP, whatever have you. I need to be okay with her other doctors too. And so I respect them because they care for her. That's the working assumption, that they're caring for her in the best form and fashion. They see her clearly, despite any subjective presentation that day. But a personal trainer typically in the States will work with you over a time. It's not just like hey, I'm going to see you once a month or once a year kind of thing. In the States, it's pretty, there's options, but so you can work out with your personal trainer all the time.
They want you to do it every week at least, if not 2 times a week.
And it's in person, one-on-one typically, right? So they're watching you the whole time. They're watching you through these movements. I would just say, especially for male trainers, and we're working on this, we're actively working on the bridge between physical therapists and trainers, okay, and educating male and female alike, because even women understanding this piece of women, we have a gap. So just know we're trying to close the gap right now. So stay tuned. And literally working on a project with these trainers. I'm really excited.
Yeah.
So actively here in the area. So all that, and internationally, we're working on it, guys. We're seeing y'all clearly. We're working on the communication on our side.
I hope so. I hope every personal trainer gets in contact with physical therapists, and I truly hope that the male physical therapists out there, not physical therapists, the male personal trainers out there can learn from my case that if a woman is telling you that she doesn't feel safe, she doesn't feel comfortable in her body and the way that you're making her move it, just remember that she is a woman and that her center of gravity is different. And I know that my personal trainer thought about that and was like, but I literally had to tell him over and over and over again, like, I can't do that because of my pelvic floor. I can't do that because of my pelvic floor. I was diagnosed with a pelvic floor condition in 2018. By the time I met you, I was already in 2021. So that's how, long I had actually been diagnosed with a pelvic floor dysfunction, right, where I had incontinence, whatever. And I don't have incontinence anymore. By the way,
incontinence, for the audience,
is you leak urine, and there's or feces.
Number 1 or number 2, for the light stomachs in the room. Number 1 or number 2. Okay, if we're teaching our daughters about this, hopefully, and our sons, guys, this is not okay, even on the child level. Okay, and we'll get more into the pelvic floor diagnoses. But for any human to have the inability to go when they need to go, not go when they need to go, that's a normal human function. I go number 1 when I'm supposed to go number 1. I don't when I don't need to. I go number 2 when I'm supposed to go number 2, but I also don't go when I don't need to. This is a normal function. If you're looking at the body, it's the piping system, right? We have control of when we turn on a faucet, when we turn off a faucet, right? You know you have to press a button to see the toilet flush. I mean, this is basic stuff. So for Amaleigh to have that diagnosis, we already have a problem, at least.
When I was 21.
Yeah. And some children have it too, but
Yeah.
again, for Amaleigh, if we're looking at her as a zebra, hopefully pediatrics will catch this earlier, right?
I hope so.
We'll start bridging that gap again, because we need everyone, right? Me catching her at whatever age and then transferring her to one of my
How old
dear clinicians.
How old was I when I met you?
I don't know.
Was I 24?
Probably.
24?
So, and I almost like medically tune out a lot of her, the details of her case that we're not going to bring up, that I probably remember in my head. But that's her story. That's her body story. So I'm not even bringing those details in, because that's what we call HIPAA, right? Do you want to talk about HIPAA?
Yeah, but I can say it.
Yeah.
And I can prompt it.
Absolutely. But I'm in terms of like, from a clinical standpoint, have you ever experienced or seen any person with any type of chronic pain, where patients like this, who are zebras and typically female, more of the time than men, have their personal information given out when they did not give consent? Mm-hmm. Right? So, I mean, just to know, guys, like, this is your story. Like, what we're talking about from a clinical standpoint, if we're not dulling it down, but just changing the hue of the presentation, we're talking about HIPAA from our side is like, we're signing off that we won't tell your story. Like, I will never tell Amaleigh's story. She alone and her body will. She actually has to legally give me consent, written, verbal consent, right? To share it. Like, when I tell you your story is protected, I want everyone to know, like, for a doctor to go off and talk in the elevator just randomly about your case, oh yeah, I had this, God forbid they take a picture of the file and post it on social media, on Snapchat, because we think it's not going to show up someday. Stop.
Get some help.
Don't do that. Don't do that, doctors. But I know. I've given consent, though. I have given my doctors written consent that I consent for other people to view my case file.
Yeah.
I released all my medical information to my PCP once she told me that I had most likely EDS. Right. And I was like, do you remember that conversation?
I can't tell her.
Do you remember the conversation? I literally was just like, I'm not crazy. No, and I saw that there was an episode on Grey's Anatomy, and the girl had the same exact reaction that I did. I just cried and cried and cried. And it was another doctor with her. I don't want to say her name because she doesn't give me consent. But she was like, no, you're not. And was moving all my joints around, and she was talking to me. She was like, so were your parents flexible? Were your parents athletes? Because a lot of us are athletes. There are a lot of zebras walking around in gymnastics and football and track. And the reason why is because we are so bendy, we are able to do incredible things. The problem is that if you don't know that you have this, then you are not protecting yourself the way that you should be. And if nobody ever catches it, then the thing that I was made aware of is that it is not caught in women. Men have it just as much, but it's easier to catch on men because it's seen as weird if they're doing the splits. If they're sitting with their legs spread just to be on the if they're just doing the splits, or they have their hips all the way on the ground, they're doing the W pose, right? So your legs are like this. If they're doing that, then that is weird for a boy to do. Of a girl, it's so creepy. This is so ingrained in our society that we're like, well, it's seen as a benefit that your daughter is so flexible. Yeah. Put her in dance. Yeah. Put her in gymnastics. She's gonna be gifted. She's gonna be a star, right?
Cheerleader. And the higher you can kick, the better you are. Yeah. The more bendy you are. And my parents put me in everything. And the sad part is that I hated ballet, but that would have been the safest for my body. Yeah. Oh, and which a lot of women don't know. It's actually smaller movements. Yeah, and why is this good for you? And like Pilates, yeah, I think for the hypermobility, like this was. Was it isometric? What she's talking about, if this is you, go get checked out. Right? Yes. Go get tested for this. Yeah. So I want you to know, like, me hearing her story, like, because we talked about this. If your child or you sit really weird, like, you look at it and you're like, easily, and they're comfortable like that, I would probably stop them and let them know that they should stay in mid-range. Mid-range means you're not all the way extended. It means that you're here, right? You're here. And you're not here. from the doctor's side, what we need to look at is, does it sound like one of the things I think as clinicians we're always asking about pain? We're always asking about pain. Does that hurt? Does that hurt? And there's normal ranges. You can look this up anatomically. The body gives us a code of what is expected range and what is quote unquote normal or abnormal range from when you're even a baby.
Really?
This is standard examination.
So every time that I've been examined for physicals, right? For yearly physicals to like continue to be in athletics, they were checking my range of motion. So this whole time they just thought that was just great for me. They're just like, good for you.
Because you can do it. But here's the red flags that we ask for. So I think we're asking the wrong questions. What we see as a red flag is it painful? Or does it stop too early? It's not as considered a red flag if you go too far. If you have more mobility, you're okay.
That's good.
I want you guys to know that I think, again, I say it in the most loving, respectful way. I think the system's broken. We need to change things. I don't know who, where, where. I don't care. And I don't care. We love you all. 1 hour on the clock, and we're gonna hopefully order cheese sticks tonight. Or maybe we'll find something to eat, but because we deserve it. Celebrating. So, guys, I want you to know that, like, that system, I want to rewrite. Yeah. I can rewrite an examination and a screen for trainers, for people who are doing physical screens. I can rewrite it. I can reteach us. We can reteach ourselves, hopefully on the patient level. What if every single person who ever saw this video didn't need someone to tell them that you didn't need me, right? You needed me, right? I needed her, right? To confirm that I see zebras, right? I want you to know that, like, as much as she had a gift, maybe, that this opened up a path for answers, for the truth of who you are and the gift that you are, because she is, right? I want you to know there's a Ferrari and there's an 18-wheeler. There's a lot of cars in between. Some of them are electric. Some of them run on gas. Some of them run on diesel. Guys, literally look around you. Our world is made to be a mirror of us. She is different. I would not give you a Ferrari in front of you and you would tell me that's the same thing as an 18-wheeler. You would look at me sideways. And if I fed the 18-wheeler what I feed the Ferrari, I would break it. Crazy. They're two different machines. Yeah. Do they both have wheels? Yes. Do they both have metal? Are the parts on the inside? Are there certain things that are necessary? Absolutely. Do you need a driver who drives the car differently? Oh yeah, why? Is that important? I don't know. That's you. You're the driver. All right? We as the medical team are assessing from the outside in, sun sign, moon sign, right? Rising. And this is literally, y'all, I've already talked about this. I've already talked about this on a podcast. Check out, and we're going to add in the link, okay? Now, add in the link. I've already talked about this to men on the Men's Health podcast. Yeah. So, for women, I'm sorry, even if this audience is just female, guys, I've already talked to you about it in a different place, okay? This is outside of gender. This is outside of male, female. This is the whole rainbow, guys. So, from her side, she's a Ferrari. She's not an 18-wheeler.
I'm a Ferrari.
You are.
I feel like a broken down 2006 Prius.
No, and I challenge us in the future to be better, because what if you knew?
If I had known, you're correct. Okay, I see where you're going now. If I had known that I was a Ferrari, if my parents had known that I was a Ferrari,
because they're Ferraris,
then they would have, exactly, if they had fed me the right diet, and they fed me as healthy as they knew how, they did not feed me McDonald's every day. My dad was my soccer coach, and he said, no Capri Suns, no gummies, no whatever, at the halftime. No, he only fed us oranges and bananas, and then we would have Gatorade that was sugar-free. Okay. That he mixed himself. Back in the day where they had the powder Gatorade.
Your dad is so smart.
Yeah, my dad was like,
so
no,
smart.
absolutely not. We're not having that. But the problem is that they never put me in any type of weight training that I would have and protected my joints and learned how to use the smaller muscle groups around my joints to protect them, because it was always a benefit for gymnastics, for cheerleading, for dance, for soccer to be able to kick my legs that high, for me to be able to fall on the ground and not break a bone. And I'm not breaking a bone because why? Because I'm dislocating. The times that I should have broken a bone because I just dislocated so easily and just could pop it back in is insane. And it was always seen as a benefit. And the problem is that I wasn't eating enough protein to support my collagen to regrow. And I wasn't eating enough fish, enough chicken. And that was really the issue. And because at the time, the whole Jenny Craig thing.
No, it was that era.
Yeah, I was raised in that era. And so everything was sugar and fat free.
Yeah.
Fat is what fuels your body. You need healthy fats. I'm not saying that you need to eat Crisco, but you need to eat healthy fats. And my parents were really scared about that. And they were as health conscious as they could be. And honestly, nutrition is changing every single day. And I feel like we need to have nutritionists on this podcast.
I already have them.
Oh, great. Fantastic.
Stay tuned, guys.
We need that because nutrition is huge. It is invaluable to the healing of EDS. And it's not healing, really. There's just treatment. There's just management. There is no healing. There is no cure for EDS. There is no cure for POTS. No matter what these people want to say, there is no cure for postural orthostatic tachycardia syndrome. Ooh. There is no cure. The cure is trying to manage what you're eating. And I don't think I touched on this ever before. It's the first time I get into this. Diet is really, really important to maintaining your body. And I know that everybody knows that. And I obviously have my cheat days, just as everybody should. I believe everybody should be allowed. I know you were really conscious about that last time, about what we're eating. You're allowed. And fats are good for you. And sugar is good for you within moderation. And I'm not talking about Coca-Cola, right? Even though I'm a Coca-Cola addict. I'm not talking about that. I'm talking about fruits and veggies. That is 100% good for you. You need carbs, you need fat, you need protein, and you need lots of protein, more protein than I think anybody tells you. And just to exist, I have to eat my body weight in grams of protein every day. And they're like, but why do you need to do that? You're not some big personal trainer. I have to do that just to exist. Just to exist. I should really be exceeding. Otherwise, I'm falling on the floor and I'm dying. I'm in the hospital. I can't poop. I can't breathe. I am throwing up. It's. Do
you want to tell them how like the protein, like how that affects your system, like your digestive system?
Yeah. So the sucky part is that protein's really, really hard for me to digest because of my gastroparesis.
What I just asked her is that I already know the answer to.
Yeah. The sucky part.
We should know the answer.
Yeah. The sucky part is that I already have a failing kind of microbiome that is constantly angry at itself because of EDS. I also have MCAS, which is mast cell activation syndrome, which is a disease that causes your mast cells, which mast cells are similar to T cells, right? T cells would call for lymph, like lymphocytes, which is white blood cells. Mast cells call for histamines, where we think about Benadryl as an antihistamine. Histamine is what gives you an allergic reaction. So I have allergic reactions to everything all the time. I'm having one right now on my ear. Like, it's insane. My body overreacts to literally everything, and I never know what it is. I could drink this. I could drink this today, and I'm fine. Tomorrow, I could be anaphylactic, and you never know. So that becomes a problem whenever you're eating proteins because of the histamine reaction. Your body naturally wants to create a histamine reaction to break down protein and fats. It's because it's very hard to break down protein and fats. I'm sure everyone knows this, right?
We aren't taught that. Like, I didn't get that, and I don't think I went to the restroom for that long. Like, the detail that she's talking about, I want you to know on a personal level, I had to have mentors and coaches teach me this. You would think at some point, like, the nutrition talk happens from my background. Guys, no. We didn't.
Huge.
But we are expected to learn the anatomy, the physiology, basically the wiring system is the nerves, the electricity, and you guys can see the podcast. The other one on the men's health that we'll post. Anyway, so the nerves are the electrical wiring system. The muscles are the movers, but then we have connections like ligaments and the The cells are different. All the makeup is different. The lymphatic system is different. It's literally like the highway. I mean, to say that the lymphatic system is the same as an artery or a vessel, like your pumping system, it's literally not even the same. Like, we have super specialists on this stuff. We know how the system works differently.
It has the same proteins that make up the surfaces, right?
Yeah. I mean,
it has
yes.
yeah.
Which I think is where your problem comes in.
Well, because it's collagen based.
Right, exactly.
My problem is collagen based, not keratin. So I make fine keratin. So like my hair is great, but my skin is not. But yeah, they are different, and it was really interesting once I learned. And when I went to my EDS specialist, she was like, "Oh, you're an esthetician." She literally was like, "Oh, you're an esthetician. So you already know what collagen and mast cells are." I was like, "Yeah." She's like, "You know what T cells are?" I'm like, "Yeah." She's like, "You know what Langerhans T cells are?" Yeah, I'm like, "Absolutely, I do." She's like, "Okay, so you already understand epithelial tissue." I'm like, "Absolutely, I do." And she's like, "And you never connected the dots." And I was like, "Honestly, these doctors had me convinced that I was stupid, that I was ignorant, that I was a hypochondriac, that I had Munchausen syndrome, that I wanted to make myself sick, that I had everything else in the world but something that was actually physically wrong with me."
Objectively wrong with you.
It's objective. And the fact is that they put me on a tilt table test. Tilt table test is how they test for POTS. They put you on a table, and just the slight transition of putting me at a 30 to 70 degree angle drops my blood pressure, my heart rate rises, then my blood pressure rises to crazy high amounts because my body's trying to regulate itself. And it's struggling to regulate itself. So it's an objective fact that I had POTS. It's an objective fact that I have EDS. And the fact that I thought I was going to come in and be like maybe a 5. So the Baton score is how they test for EDS. So there's hypermobile spectrum disorder, which means you have, I think, 4 or 5 out of 9. And if you're a certain age, because if you have EDS and you get older, you should the arthritis will prevent you from moving the same way.
And I will tell you, hopefully we see less of that.
Yeah.
If
I hope we can have less arthritis.
Because the arthritis is a response that's the body is trying to protect her.
Yeah.
So hopefully, again, humanity, we learn from this that if we catch this earlier and we understand on a genetic level that you are a Ferrari, and as much as society might deem that it's valuable and actually it's productive for you to be powerful, strong, and flexible, what you actually need in your life, and guys, I've already said this, so I'm repeating myself, which I don't like to do. What I want her to learn inside her body, she's already God-given. The universe has already granted her with this range, where the majority of the other side of the spectrum has this. So her end range where she might feel pain on her elbow, I can't go past that. No one would look at me differently, and I can't. If you tried to push me, I would say, "Ow." Right? A baby there would be reflexes, right? So we see this naturally because my nervous system is wired and my joints are made differently than hers, where this, ow, you push me past that, ow, right? You get Amaleigh to this? What does that feel like?
Yeah, I mean, you can push it farther.
She goes down, guys.
Yeah.
These are normal things that hopefully we can change from a pediatric level. If we can catch this from the kids level, it's cool, right? How many cool things, how many party tricks can you do, Amaleigh?
It is the party tricks, yeah.
How many, we get excited about it, but as much as we get excited about it, and that's cool, and maybe we're little, or I think maybe I'm different, oh, you can do that, I can do this, right? It's very natural for children to find the similarities and find the differences. So maybe if we taught our children, because we ourselves learned what we are, if I know that I'm a Ferrari, I'm going to live differently, I'm going to train differently. Why? Because I have so much speed that I don't need more speed. I don't need to go further and faster than an 18-wheeler. That's easy. What I need is stability. What I need is safety. Because I'm so fast. And I've got all these cool tricks, and I look really pretty. I look really pretty on the outside. Everybody wants to, only 2 people. How many people can go in a Ferrari? Guys, I'm not
2.
sponsored by Ferrari, but this is just how
it's 2, it's 2-seater.
It's how I see the world, okay?
Yeah.
So, and I've always said I'm a European
I like that you
PT.
said that. I really like that you said the Ferrari.
Luigi follow only the Ferrari.
And because other analogies that I've heard is that we're actually superheroes in disguise.
I like that too.
Yeah, like we are superhuman. And so a little bit more about EDS is that I have a 50-50 chance of giving it to my child. If I have it, my child's going to get it. And it's not a recessive gene. In the people that carry it, it's actually considered a dominant trait in the people that carry it. That's why it's a 50-50 chance. Most rare diseases, you would think it'd be like 1 in 1,000 chance you'd give it to your child. No, this is a 50-50 chance. If I have a child, it's going to have EDS. I'm assuming most likely. And
the numbers that you're talking about too, guys, from the genetics. If you haven't had genetics and genomics, right, and gene expression, what Amaleigh's talking about is literally so simple as a box. 4 boxes.
Right, you can do the Punnett square.
Yeah, and so X, 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 Y. That's how we have a genome of whether it's a boy or a girl.
Yeah.
50-50 chance, right? So what we do is we take those boxes and maybe we'll put a link on there. So when Amaleigh's talking about recessive and dominant, this is math, but it's the natural anatomy's math.
Yeah.
Either you have it, you don't. You got it passed down from mom, dad. It's very clear. Like you can trace these, which is why Amaleigh now has her genetic blueprint code, and there's these terms that she's coming out with, and she's not making them up. It's inside of her.
Yeah, it's a COL1A2 gene that's affected in everyone that has EDS, but they don't understand which is the gene that affects how your collagen is made in your body, because your body naturally makes collagen from the protein that you eat. And I want to clarify for everyone that's listening, collagen, if you ingest it, cow collagen, if you ingest it, will help you break down protein from cows. It cannot be transferred into my skin. I just want to let everybody know. Everybody's like, oh, you have a collagen disorder, so just like take collagen. I'm like, that's not how genetics work. Thank you. Thank you for being a couch scientist, but you're not. Okay, so yeah, so it's a 50-50 chance that I give my child this disease. Now, and it's hard to diagnose, and they don't diagnose you until you're a teenager, because that's whenever you start having issues, right? When you're a child, everything's flexible. You don't even have kneecaps yet, okay, until you're 7.
And also,
so it's normal.
Hormonally, there's a change. That's why
puberty. The puberty is whenever you see, especially with girls, the crumbling of their body. Like I was capable of doing superhuman things. I was capable of playing 5 sports and every single year for my whole life. I was capable of doing all of that and singing, and I just had unbelievable amounts of energy. I had unbelievable amount of range of motion and hand-eye coordination, and I was able to do anything you put in front of me, I could do it. You gave me a violin, I could do it. You gave me a pole that I needed to climb, like all the way to the top and come back down, I would do a flip. Like, I could do literally anything. It is a superhuman gene, and that is why it's dominant, is because actually hundreds of years ago, this was a trait that was desirable within the human species. You were attracted to the people that were flexible, that were able to climb a tree faster, that were able to run faster, because you're dislocating your hips and your knees and your ankles to be able to run faster. And so you could hunt predators, prey. You could hunt anything that you wanted. You could climb for any berry at the top of a tree that you wanted, because we were capable of superhuman things. And the problem with it is we don't protect our joints anymore.
Now we don't.
The way we move our bodies is wrong and unnatural. I don't believe in, honestly, for people like me or anybody that may think that they have something like me, I don't believe in doing heavyweight competitions. It's not good for you. You are most likely going to fucking snap your joints, like for real. So I don't believe in that, and I think that's what I wanted to do. I wanted to be super, super strong, and I wanted to do MMA, and that's what I was getting into before I met you, and that's why I got so bad.
And the power.
So I wanted that, and I was capable of it, and I was good at it immediately, but the damage that it was doing to my muscles and to my ligaments, because I could not replace the collagen as fast or as effectively, because I heal really slow. It just wasn't a good combination. And the problem that we have in today's society is that we don't have proper nutrition. Yeah. We don't have proper nutrition. It goes beyond what you're actually eating. It goes all the way down to how food is being farmed. Mm-hmm. And you literally have no control over it. So people talk to me, they're like, well, you just need to eat this. I'm like, but at the end of the day, and I love my EDS specialist because she's like, at the end of the day, you can only do what you can do. Yep. Our food system in America is shit, and they don't care. They don't care about what they're doing to you. And there are food scientists that specifically design food that we eat to be more addictive, to be worse for you, to have the least amount of nutrition possible, but be the most addictive.
Why, Amaleigh? Why would someone do that? Because
you have to keep coming back. And whenever you think about the fact that food corporations, FDA, right, food and drugs are one. And food is medicine, but not in the way that they're giving it to us. It's not the way they're dishing it out. Food is medicine,
there's good medicine and bad medicine, yeah?
There's good medicine, there's bad medicine, yeah. And that is...
and medicine used in the wrong way, in the wrong time, in the wrong place, with the wrong intent, kills.
Yeah, and so for all my little native girlies out there, you know what good medicine and bad medicine is. Mm-hmm. This right now is good medicine. Mm-hmm. Yeah, talking about it is good medicine. Talking to people, meeting people by design, like, that's good medicine for you. Yeah. There are plants that God gave us, or whoever you believe in, the universe gave us, that are going to help us. And unfortunately, we deny it. I mean, and it's so interesting to see the FDA come out with and approve drugs that many indigenous people for all of time have said these things work, and then we're taking out chemical components from this plant being like, yeah, this is good for you, but whatever they're doing, whatever the native people are doing, the indigenous people, is wrong, and it's witchcraft, and it's this and that. It's like, but didn't you just take that chemical out of that plant to give it to me as a pill?
And then
I could just drink that tea and I could be okay.
And neurochemically, how your body responds, guys, is different.
Yeah, so you can tell when something's synthesized. Your body knows when something is synthesized and broken down and not in its right element. Your body knows whether or not you're consciously aware of it. Your nervous system is like, yeah,
your whole system knows.
Yeah, that's wrong. Yeah,
it knows.
That's not right.
It knows, and that's why we have cancers. Because at some point, and you can talk about this too, what is a cancer cell? Mm-hmm. There's always cancer cells in our body, whether or not they're active or inactive. We have the epigenetic
whether or not they're spreading or not, yeah.
I mean, like... But, and then there's the whole spiritual side and the medicinal spiritual side as well. And we'll get into that in another podcast because Lord have mercy. Yeah. I mean, it's just, there's so many different avenues. But I do want to say, as a Ferrari, guys, and we'll probably get into this, of like, hey, I know I'm a Ferrari. What do we do with that, right? And like, if I am going to treat myself, if I don't have access to a physical therapist, a personal trainer, an OBGYN, if you are in a city, a country, a tribe, a land where you don't have the round table, you're like, I am the round table. Regardless of whether or not you have a group and a society and a tribe around you, hopefully you will understand what you are. When you understand what you are, you can understand, like, you will feel that internally, and there's a lot that we can get into on that level. But like, if you know that you're a Ferrari, you're gonna drive your car differently. You have 4 wheels. 18-wheeler has 18, guys, right? You have to know what country you're in and what country you're in, and the roads and the rules, and all of that matters. Mm-hmm. I mean, we can get into all of these details on an anatomical level where literally you're gonna drive your car differently because you know yourself.
You're not I think what I've learned the most since being diagnosed, because it was a roller coaster of emotions for sure.
Everybody, brace!
The most is that you have to advocate for yourself. Mm-hmm. You have to understand yourself. You have to be one with yourself and be in your body and be present in your body to know what's really going on with you. And you have to sit with it, I think, for a little bit, and really, instead of just giving your life to these doctors like I did, and I just was like, yeah, okay, I'm crazy and I have anxiety. I believed it. I think you need to sit with it and think about, okay, what does this feel like? What does this feel like? I'm not saying everybody out there has EDS. I'm not saying that. But I think there's a lot of us that are undiagnosed. And so if I can touch one of you right now, then I want you to know, if you can do certain things with your body, you are not double jointed. Double jointed is a myth. It's a lie. There is no such thing as being double jointed. If you have a lot of joints that you're double jointed and you did a lot of party tricks, you might want to look into HSD. At least HSD. EDS is very severe. HSD can happen whether or not you have the gene for a collagen disorder. And HSD, I would say a lot of people are hypermobile and on the spectrum of hypermobile, lots of dancers, lots of athletes. Mm-hmm. But a lot of people have seen like these athletes, like these football players even, that are running around with braces on every single joint, and you're like, what's wrong with them? Are they hurt? No, they're not. They're preventing themselves from getting hurt, and they probably are on the spectrum. And I wish spectrum of hypermobility. And I wish that they would actually come out and say that.
Right, because it's considered weakness in a lot of sports if you even have a knee brace or you have to ask for a knee brace, or then, even on the
And it's
NFL level.
not. Because if I had that, then I would have been okay.
Exactly. And then part of it too is hopefully like in that, and there's a time and a place where you brace.
Everybody brace!
And you and I have had that conversation too.
Right. Yeah, I have to work on my strengths.
I never
as
want a patient ever, even if they're not on the spectrum, and it's actually unhealthy, guys, for you to depend on something outside of yourself, which I think is beautiful. It's extremely unhealthy and unsafe for you to depend on anything outside of you to hold you for forever. Even though it might feel good, if you do not create the internal stability and isolation of strength, can I hold this? And guys, this is basic PT 101. Can I hold this? Isometric. Can I slowly get out of it? Eccentric. Concentric. Can I move through that? And then we add speed and power and all of that on top of that. But at the very baseline, when you get out of surgery and the body tells this, at the most extreme trauma, intentional or unintentional, what do you start with? Like black and white, guys. Day one in the hospital, right? Patient wakes up. They had a knee surgery. Let's make it super basic, right? Now, Amaleigh's not basic, right? She's a zebra. But let's go down to a knee joint. And if I have a surgery, what are you expected to do to gain strength, to walk again, to load that joint? And ultimately what we're telling the brain is, it's safe. You're safe. Yes, I know, and I tell my patients to have a conversation with their bodies because that is typical. We call it graded motor imagery, and there's chronic pain education, CPE. Guys, again, this is a subspecialty, and we can add their specialists in the United States, and hopefully overseas we'll meet them too. These specialists exist. We'll bring those specialists in. I'm talking about from day one, if you get surgery and it's an intentional trauma, and it's a carpentry shop, it's a workshop. The guys play the music. I say guys in general because it's a mixed crowd. So
more than likely, orthopedics are men. They have to be very strong.
Very strong.
To break bones.
And it's carpentry at its finest. And
I don't know if you guys have ever seen a knee replacement surgery.
All you have to go is YouTube.
Yeah, I've seen
it's out there.
It's pretty insane.
It's aggressive.
I've seen hip surgeries. I've watched them.
I mean,
and they are the reason why they're mainly men is because of the strength that's needed.
Have to. Guys.
You could do it. You're strong.
I get it.
You could do it. I could not do it.
I looked into it, right? But they're like, no, your hands are actually the best for neurosurgeon. You have the best. I was tested and
yeah, you have really calm
for
hands.
2 days.
I could never. My hands are so jittery.
And it was like, I don't know how they were. I guess it's the piano. I don't know what it was. The musician in me.
Did you play the piano?
Yeah, I did.
That makes sense.
Guitar.
Yeah,
but guitar hurt my fingers as much, and I really wanted to do drums if I had to pick one. But I was classically trained in piano, and then voice also too. But as Amaleigh was too. Yeah.
Yeah.
Yeah. We'll sing for you another day. But all that being said, guys, in the terms of, oh my gosh, we talked about Ferrari.
So in the terms of a knee joint, whenever you get a replacement, I think is what you're saying.
Yeah.
I'm going to keep on track here.
It's basic 101.
Yeah, it's basic 101 that you need to get to...
Can I do this? Can I do that? Can I do that? Can I do that?
Yeah.
No rotation. We're not getting crazy with it. Very plain up, down, in and out, where nothing is moving the joint, but everything around the joint. Can I hold this? And that's where we get back to Ferrari stuff. We'll probably have a whole section on like if you have someone walk in your door, and it could be a child, right? Because we need to not disregard child pain, and that's a whole nother, that's child psychology.
It should have been caught when I was a child.
Exactly. And hopefully, again, we'll bridge the gap. But basic 101 would be, can I hold this? And you can make fun games out of it too. Hey, let's freeze, right? And if you think back to what you said about climbing trees, what does it take to climb a tree? You have the flexibility. I can get there, but can I hold it?
Yeah, can you grip the tree?
Kind of like rock climbing, not fast rock climbing. I'm talking about the crazy rock climbing, right?
You're talking about like free?
Yeah.
Like
so what does that require on all levels? It requires a hold. Now, I'm not encouraging those with EDS and...
Don't rock climb.
Okay, guys, that's to the nth degree. I'm talking about if this was a desirable trait, if we can do the crazy stuff, what is expected of our bodies anatomically is that it doesn't matter how high, I get so excited, it doesn't matter how high it is, how far it is, how long it is, think Ferrari, I will be able to hold this.
Yeah.
And not only can I hold it, I can come out of it slowly, I can go into it, and speed's easy.
Yeah, I can.
Speed's easy.
Yeah,
but
I
also
can.
where you can hurt yourself.
I can
if you
do
don't have the
things
baselines before.
so fast, and it's funny. My family calls it the Amaleigh way, right?
Do
like,
they?
Yeah, they do. They call it the Amaleigh way. Literally, like my Uncle Steve and my mom, they literally will be like, I'm like, oh, I moved this couch and I feel awful, or I stood up too fast, and or I stood up and I felt really dizzy. And like, okay, well, did you stand up regularly or did you stand up the Amaleigh way? And I'm like, I have to think about it. I'm like, probably the Amaleigh way, because my way is hard and fast all the time. Hard, fast, all the time. And no stop, no breaks.
That's easy for you,
yeah. You know this from treating me, is that I can go into the position really easy. Can I hold it? Can I hold it? Can I come back down effectively without it? Right, without my joints it's like this. It's like squeaky.
She got so mad.
To bend my knee, it's like it's like this. Every time I bend my knee, it's literally.
I think you said you were like, why is it doing that?
Yeah.
Like what do you mean? I was like, hold on, can you hold it? You're like, why am I shaking?
Yeah.
Right? You ask a Ferrari to just wait at the start line?
Yeah, you can't.
You don't want to hold it, right?
I want to be in end range.
Yes.
I don't want to be in mid range.
No.
To hold the mid range activity is really hard for me.
Yeah.
Because my strength that my body knows is always end range, but I need to stop relying on the end range.
And so she has to look at...
Because that's for longevity purposes, as a living human being, you can't be in end range. And end range means that your full capacity of how far out you can hold your leg, right? How far, completely locked. How long can you hold it, right? You think about people, I don't know if
it's actually bad for lifting. It's bad for lifting at end range. We will cause damage, but again, most people have pain there. They don't have pain at the end range. So we had to work on elbow. I was like, what feels like, and this was a question, a game we can play, what feels like straight to you? Close your eyes, make it straight. Is it straight? No. Mm-hmm. Amaleigh's going to go past because her nervous system says, end range is unsafe. Let me push it to my limits. Now it's the limit. She doesn't feel it until it's past a normal joint's range, which is why she's accidentally causing pain to herself. But her receptors inside the joint don't send out a pain signal. They don't say, Amaleigh, stop, right? Mm-hmm. Mine says, Sara, stop, right? Aha, we're about to get there. She doesn't get that until
I don't feel it.
She done passed the train station.
Yeah, I don't feel it until the next day.
And then you pay for it, right?
I pay for everything that I do. We call it in the chronic illness community, especially people with POTS. We call it spoonies, right? How many spoons do you have in the drawer today? That's a question I have to ask. Because you may have eaten yesterday off the spoons. You may have eaten soup. You may have had ice cream. Now you started with 16 spoons. You normally have 16 spoons in your drawer at all times. Now today I don't have any spoons left. So, because my energy levels were spent yesterday. Mm-hmm. I walked the dog. I painted the walls. I put up posters. I did my application for disability. I did the phone calls. I did this. All of this takes so much energy out of me. And so today I start and I'm like, I don't have any. Do I have spoons today? And spoons even count for doing your makeup. Mm-hmm. Doing your hair, brushing your teeth.
On a hormonal standpoint, ladies, we should.
Yeah, and oh my God, the cycles, dude, the estrogen, and I think the estrogen goes crazy. Being a woman with EDS, because you're more prone to migraines if you have EDS because your brain is literally different. You're more prone to migraines. And then if you're a woman, high estrogen levels cause worse migraines. So if you're about in your luteal phase, if you know anything about your cycle, your luteal phase, dude, I can't fucking think. I can't walk straight because I have migraines with auras. And nausea, and I'm incapable. I'm incapable of doing anything during that time.
And each one of those that she said is a different diagnosis, like aura, like nausea, right? All these are different medical diagnoses.
Yes, and I think people think that a migraine is like a headache, and I had to explain to producer Matt over there. Poor Matt, he's sitting on the floor. I explained to him, he was, and people have sent me things, and I'm like, about migraines. I'm like, no. You're talking about dehydration. I'm not dehydrated. You're talking about dehydration headaches. I don't have that. I have spots in my brain that light up in an MRI that prove that I have migraines. Migraine is a legitimate disorder, and it's because when your brain doesn't have actual neurons that send pain signals, you can't actually experience pain in your head. If you're doing brain surgery, you won't feel it. They'll have you awake. You actually can't feel them touching your brain. So what a migraine is a lack of blood flow, right? So lack of regular blood flow. So then your brain, the neurons in your brain are like, well, lack of blood flow, what does that mean? What does that mean? Oh, I guess pain? I guess this is pain? But it's not. It's not actual pain. It's not pain in the way that if you cut your leg, but boy, does it feel like someone is jackhammering inside of there.
And I'll be honest with the audience. I'm on the spectrum of hypermobility.
Yeah.
Right. So like, and we'll get into mine later. Like, it's a gift and a curse, because there's times in my life where I know that my stretchiness has saved me, and at the same time, I'm like, and also like I was that person. I was that person who was praised for all of the things that I could do. My brain would perform. I could sing. My vocal cords would vibrate differently. That kind of thing. I could hear pitch intonation differently. I feel it differently in my body. I mean, we're not alone, but we present differently. And so I want you to know that just because you might not, Amaleigh's story might not be your story, I want you to know that you also need to be looking out for other things. And we'll get into mine, because I'm on the spectrum of stretchy, and I would have been a great cheerleader. Maybe one day.
So do it.
So anyway, all that being said, it's just because Amaleigh's symptoms, we need to know how far this goes. And Amaleigh's not the only type. There's other types on this end of the spectrum. I am over here, and I still am on the stretchy, and I was failed as well by the medical system. I still love them for everything that hopefully they intended to do, which was heal. That's our promise as clinicians, is that we promise that we will never harm you. And this breaks my heart to say, guys, and I'm not going to get into my emotional heart space, but I think that we're falling short. And I had that conversation yesterday with a colleague. I was like, I am sad, because for medical clinicians or healers, our intent but to become a healer is that we will never harm you. But if I refuse to take the lens or see my own lens and see myself clearly, how will I see you clearly? And I know, without my ego being present, that my world and my specialty clinically is red, white, and black. And I know that the rainbow exists. And I know who to get you to, so they can see you clearly in their other colors of their lenses. And then by the end, we have a prism of you.
Yeah. And
so just know that, like, if we can't see our patients in that prism light, and I think the most beautiful way to depiction that I have, it's my favorite right now, is look at a star and how a star is born. Like, these what I'm describing already exists. And what it looks like to me is two lenses colliding at one moment. Two lenses that come together literally out of the darkness, and they collide. But both ends of that spectrum and the hues, if you look at it, it's my favorite picture. I think it's on my profile right now. Guys, this is Amaleigh. A star was born. But I need to know that not only did I can imagine what she looked like on the hue spectrum, that I need to know that other clinicians who are looking at her star, not from the moment of conception, right? For that person being born, that's the neonatal side, right? Those gifted to see inside the womb. Oh my gosh, that's a whole nother specialty. Yeah, and we'll get into that. We have those coming up. Stay tuned. But I need to know that once she is outside of the womb and we see her here, that we're watching her and seeing her clearly. Until the day that she decides to go out, I need to know that we're watching that star. And I don't want to wait for a shooting star to then say, wow, she's so beautiful. We all will have our shooting star moment, and I need you guys to know that you are one, and find the people who see you clearly, and you will know that. And I think, going back to Amaleigh, what does it feel like for you as a patient when you are seen?
Yeah,
And you don't have to talk about it. If you don't want to.
Was never seen clearly, even by my own parents, by my own ex-fiance. The amount of times that I've been yelled at because, well, you did this yesterday, right? Like, you were able to move a fridge yesterday, and you're telling me that you can't make me dinner?
Spoon.
And it's like, I overdid it. And I didn't even know how to clearly explain it. But I knew what was happening. I just couldn't explain it. I didn't have the medical I had medical knowledge, and I had at one point in time flirted with the idea of being a doctor. And the reason why I studied psychology, even though I was a zooarchaeology, right, animal science, like animal bones and geology major at first in college before I became an esthetician. I studied psychology as my minor because I wanted to figure out what the fuck was wrong with me. Because everybody kept saying I was crazy, but I was like, what is wrong with me? And the fact that really nothing was wrong is crazy. So when I was seen by you and then the other woman, I don't know if she wants to be said.
Right.
When I was seen by you two, it was the most liberating feeling, and I went home and I did all my party tricks. It's like I remembered all these things that I used to do as a kid because I wasn't doing party tricks anymore. But I remembered that I could do them, and I sent you a video of it. I was like, holy shit. I was just crying, saying, I'm not crazy, I'm not crazy. I kept saying it, and maybe I could post it. Maybe I'll post a video at the end of this so you can see. Just, I'm not crazy, I'm not crazy. I'm not crazy.
Right.
I'm not a crazy person. I do have all these things wrong with me, and it doesn't make me a bad person. It doesn't make me weak. It doesn't make me anything. And I think at first I felt really weak, and I felt really hopeless. And then I came to a point in my diagnosis where I was like, no, I can just change the way that I live things. And will I ever be like my friends that are not on the spectrum of hypermobility? No, I won't ever be like them. They will probably never be able to experience what I experience. Nobody could even imagine. A regular person doesn't have the type of pain that I experience in every single joint. No one could even imagine what that actually feels like until you have it. And I pray that no one does. Like, I don't want anyone to get, other than I have a person in mind that I like really would like to like implant his brain in my body so he could be like, dang, what, why, ow,
yes.
why does everything hurt? Like,
that's
why? Like, I want, but that's like my worst enemy. But most worst enemies, it's just like one person that I wish that they could experience that, because they were just so doubtful and mean to me, and I just wish and think that I'm a pussy, and I wish that they could feel it. So they'd be like, and it's a man, of course, and it's like, if you knew. But to get back to it, to feel seen was life-changing, and it's indescribable. And unfortunately, even though I have all these diagnoses, I still get overlooked. And I still get misdiagnosed with things. And I get told, like, well, you have POTS. It's like kind of one of those conditions that to have EDS, POTS, and MCS is kind of like a life ruiner for a lot of people, and it is kind of for me as well. I can't do much. I realize that I really can't do much, and that's kind of hard to face, because I got to such a severe point before anybody ever realized what was really going on. I got to the point where I can't even really do desk jobs, because like right now, I'm going to take after I write this, I'm going to have to go take muscle relaxers, I'm going to go take pain medicine, I'm going to have to lay down and not move for like 18 hours.
This is big.
Yeah, not even pee. Like, just this is costing me, like, a lot. And to have someone see me and see that and understand, it is kind of an out-of-body... I don't know how to explain it. It's like...
Yeah. You said it. And this is why I want to rewrite the questions, guys, because I want you guys also to know that there doesn't exist, or if it does, I think the questions we can add to it. The question is not, what is your pain? Can you be honest? There's days where the pain scale doesn't match what I'm feeling internally, and my face isn't going to match what I'm feeling. And if I told you actually how I felt, you wouldn't believe me. You would not believe me. And if I gave this to anyone else,
they'd freak out.
I think they'd want to die.
I think because, okay, so I've had a nurse, and we'll wrap up soon.
Yeah.
It's getting on 2 hours, but
Sorry, guys.
I walked into my EDS. I walked into my EDS
marathon
clinic.
runners.
I went into my EDS clinic like I do every 6 months for a checkup to make sure that my medications are right, that everything's okay. Because if you guys don't know, there's millions of people that are like me, and there's only 522 specialists as of right now for EDS, and 90% of them have EDS themselves. So the people that are actually focusing on learning and researching EDS are people with EDS, because we want to know what the F is wrong with us. We have probably been the people that are considered hypochondriacs because we've been researching our whole lives what is wrong with us, right? Like,
we
what does this mean? We can't tell them what we actually think it is, right? And I have had crazy thoughts that I was like, am I dying of cancer and nobody knows? Do I have some rare cancer? Do I have some rare disease that nobody knows about yet? Am I going to have to die before someone knows what it is, right? But I remember walking into this EDS clinic, And the nurse was like, so what's going on with you today? And I was like, sorry, I was sitting here and I was putting my sternum back in place because my sternum was out of place and my ribs were over here and my sternum was out this way. And she could see it. And I was like doing this, she's like, what are you doing? What are you doing? And it freaks everybody out. They're like, what are you doing? I'm like, I slept wrong and my sternum is out of place. And she's like, huh? And I'm like, yeah, I'm sitting here with like my phone. I'm like putting my phone against it, trying to push it in, right? Because it's poking out to my right.
Shocked because also on an orthopedic level, if a sternum is out of place, what we're taught in school is that is a red flag surgery, right? Mm-hmm. And it's a degree. There's degrees of joints displacement, and typically black and white, not red. Typically black and white is it's either out of place or it's in place.
Yeah.
And you either have to have a surgery or you don't. Or if it's out, or if a rib is out, you can't breathe. Like, there's a certain presentation, but I think needs to be a whole subspecialty of orthopedics who are looking at you guys.
Yeah.
And there's certain tests that you should know on a baseline level. You should catch this on the spectrum because you might show up with only one of these things, but the other things the patient themselves might not be aware of. Anyway, continue.
Yeah, so I walked in and I was like, my sternum's out of place. And she's like, sweet lady. She's just like, what are you doing? What are you doing? She's like, oh, you know what? She's like, you have EDS, don't you? And I was like, yes. And she was like, okay. She's like, I always forget with you guys. She's like, I don't. She's like,
she said that?
Yeah, she's like, I always forget, because she's just a nurse that works in that clinic.
Yeah.
But
it's not abnormal.
But it's not.
Uncommon.
She doesn't see just EDS patients.
Oh.
My doctor, right? She subspecializes in that, but also MS, right? But she herself has EDS. So
Got
interesting,
it.
yeah. So, but the nurse goes around to different patients for different doctors in that PM&R clinic, right? I go to UT Southwestern. I don't really have a problem saying that. It is one of the best hospitals or hospital groups in North Texas for any rare disease because it's a research hospital. So
it's looking at her genes.
Yeah. So I have a geneticist. I have all these. I have so many doctors. It's insane, right? It's crazy. Yeah. When I was filing for disability, they gave me 4 spots. And I was like, I have
the attachment, right?
So I have 16 different doctors that I see at different times. So, yeah, like, what medication? Like, I ran out of space, to write all my medications. It's crazy. There's medications that I have to take every day. There's medications that I take only in emergency to prevent me from going to the hospital. Because they don't want to see me at the hospital and I get mistreated, I get misdiagnosed, and I get wrong, people have given me wrong medication. But okay, sorry. Me and you are so off track today. But that nurse was so freaked out. I remember her name, but I'm not going to say it. She was just like, how do you do it? She was like, I don't understand. Because I just had a woman in here yesterday whose clavicle was sticking out. And she was just like, and she was just talking to me like it's a regular Tuesday. And it was a Tuesday, right? She's like, I don't understand that. How are you not in the ER right now? I can see that your sternum is out of place. I can see you're trying to put it back in. How are you not in the ER? And she was like avoiding looking at me because it freaked her out. It freaks a lot of people out what I can do.
It's not
normal
for them. For them, it's not.
Yeah,
that
so
would be
they're
really bad.
So, and for you, your sympathetic nervous system looking at me is like, oh my god,
you're gonna vomit.
Yeah, you're like, this is like some Saw horror movie stuff that you're doing right now.
And you're chill.
And I'm chill. And I'm not happy about it. And I'm clearly like, I can't breathe because I'm trying to get this back. How do you do it? And my answer was, well, think about this, right? You have a splinter. So first you have a splinter. Awful, horrible. Say it's a really deep one, or like a hair splinter, right? I don't know if you've ever had a hair splinter. No, you've never got hair. Anyways, maybe, have you ever had a hair splinter? Okay, so it's like that. So it's like, it's so far embedded and you can't get it out and you're upset about it, right? But then as the days go on, your body will eventually get used to having that hair splinter there and it will work its way out eventually, right? It's the same kind of feeling with me, is that I didn't start out having this amount of pain in every single joint. It came on slowly and it came on from different injuries I just never healed from. And so as I grew up, my pain got higher and higher and higher and higher and different, because I have all different, they asked me like, what's the pain scale? Where does it hurt? And then how does it hurt, right? Is it sharp? Is it this? Is it that? And it's like, well, what part of my body are you talking about? Because I have nerve pain throughout here. That's fire, itchy, burny, right? That take Gabapentin for. I have pain in my knees. That's deep throbbing clicks. And then I have pain in my pelvic floor that feels like someone's stabbing me, and it feels like someone is jackhammering into my hips or drilling into my hips. My head pain is different because someone's like hitting me, like stabbing an ice pick in my eye and just going all the way through. Like the pains are different, right? And if you just slowly are absorbing this pain, I feel like I'm absorbing it, right? I don't feel like I'm really experiencing it. It's almost like something that's going through me. Does that make sense? I absorb all the pain. And it just came on so slow and so progressive that it is so normal to me. So the only time that I would ever, even though if you put yourself in my body, it would be a 10 and you'd be freaking the fuck out. Freaking out if you woke up and your shoulder was out of place. Freaking out, right? I am just used to it. Does it hurt? Absolutely. Absolutely it hurts. But my level of
like proprioceptive awareness is what we would call it.
Yeah, like my proprioception is horrible. But my tolerance level to pain is absolutely insane. It's so off the charts. I'm so tolerant now. Think about like opiate addicts, right? They have to continue, or like any addict, like you have to continue to get more and more and more and more and more for it to actually give you the same effect. It's the same thing with pain, in my opinion. You just tolerate. You just learn to tolerate it. At the end of the day, lady, nurse, I have to move on with my life. I have to live. I have to eat. I have to drink. I have to go to the bathroom just like everybody else. And so I can't sit here and cry and go to the hospital every single time that my sternum's out of place. Otherwise, I wouldn't be here, right? I wouldn't be here right now. So you just get used to it, and it's sad that we have to. It's sad that people with EDS have to, that it has to get so bad most of the time for women specifically. They don't get diagnosed until typically 25 to 50. And I was right there at 26. I was right there at 26.
We ladies, we got to do better.
It's over 80% of us get diagnosed that late.
Now, like, if you or your family or, like, again, offspring down the line, you can teach them.
Yeah, I can now teach them and I can protect them. Now, I wouldn't most likely allow them to play combat sports, like any type of sport that would cause them great harm. Like I probably would not let my child play anything like basketball, baseball, football, soccer. I would not, because it's high impact. I wouldn't do gymnastics, but they could dance, they could do some things. Baseball would maybe be okay if they were in the outfield or something.
And I want you guys to know, like, Amaleigh's making this decision for her, like this discussion is based on what Amaleigh's feeling in her body. And I want you to know, if you are a woman and you're having children and you're making this decision, I'm putting them in, I'm not putting them in, this is not a judgment space at all. And then that's, again, child psychology, parent, all of that. But outside of that, I'm hearing and I'm honoring what Amaleigh's saying in the discussion of future motherhood, as I'm sure that she would also look at me at the same lens, and I'm being like, yeah, I'm on the spectrum, and depending on who my children's father is, we will have to look at, am I marrying a Ferrari? Am I marrying an 18-wheeler? Right? Like, what is his genetics coming in, his awareness, and how he lives matters.
Yeah.
And how he's super bendy before he's met us.
If he's super bendy too,
right?
Even if he's not injured, even if it's not bad for him because he never got really badly injured. Like I was in 3 wrecks all within a year that were very bad, high speed, and that's most likely what caused me to be so bad. One of them I was unbuckled for, but you have to think about it. And I've had my ex-fiance literally be kind of uncomfortable with the idea that I would not let them play sports that were high impact because he played them. And he was like, society? It's society. They think, and he's like, well, you don't really know. It's like a 50-50. I'm like, 50-50 is really high. 50-50 is really, really high as far as like getting a rare genetic disease. That's what's considered a rare genetic disease. It's not rare in families though. It runs in families like rampant. Like it's 50-50 chance.
Dominant.
Like it's a dominant trait for people that have it, and they pass it on as if it's a dominant trait. So I don't feel comfortable allowing my children to play sports that are going to have contact like that, like aggressive contact. I don't feel comfortable with them playing soccer. Soccer is one of the worst for head injuries, and I have tons of concussions from soccer. Like I don't feel comfortable with that. And I don't think that it's anyone's place to tell me that it's wrong, that I don't want to let them, or that I'm depriving them of anything. I would never deprive my kids of anything. But if they know that, hey, I don't think it would harm them to know that. To be like,
And
if you want to play tennis,
discussion.
you can play tennis. If you want to run track, you can run track. If you want to do dance, you can do dance. If you want to do certain things with your body, then you absolutely can. I don't want to deprive my child of activity because it's very important for muscle building. But it has to be something that is going to protect them and make them strong.
And by the end of that, they will know what they are. and who they are.
Eventually they will know. And it's only because lots of children are very bendy until a certain age, right? So if I'm not encouraging them to overextend, then hopefully they won't get as bad as me because I was encouraged to overextend. So I want to teach them to move their body correctly and to wear, I'm probably going to have them in braces while they do activities, even if it is like tennis or something that's considered non-contact. I'm probably going to have them in braces while they play, only while they play, just so they can prevent themselves from hurting themselves.
And there's different degrees of braces too, guys. So like
soft braces at least.
Yeah, there's like different degrees of like PSI and pressure that you can look at, different neoprene sleeves, and there's research done on this too.
Yeah, I'm not talking about full like ACL
There's
surgery,
options.
like robotic. I'm talking about just something that just prevents. It just has like my elbow braces. It just has a pad right here that just reminds me not to move my arm a certain way.
Because you don't have that because
So my elbow doesn't sit here, right?
Yeah.
Like that's
Very
all it's there
natural.
for. And that's all I want to teach my kids is to move their body in a healthy way. And I want the coaches that are around them to teach them, to let them know, like,
to honor that.
hey, we won't know until later because they haven't. Maybe they will by the time that I have kids, right? That they will know what gene it specifically causes, or what deficiency actually causes the type of EDS that I have. It's genetic, but they have but we don't know the marker yet for my type of EDS. There's 13 different types. We know that mine exists. We don't know which marker on the COL1A2 whatever gene. They don't know what actually causes hypermobile
yet.
Ehlers-Danlos syndrome, which is kind of an umbrella. They think it's 3 markers, but there's some people that are thinking, well, what if it's just 3 different types? We're just grouping everybody in.
And then that's the discussion, guys. That's our job as researchers, as clinicians.
It shouldn't be my job.
It's not
but
your
it is.
job.
But it's been made my job.
So if we can go about this on both ends of the spectrum, hence doctor versus patient, right? This is not a. Should I spill the beans?
Sure.
Spill the beans. This is not a doctor versus patient scenario. And I don't think that it ever should be a doctor versus patient scenario. At the end of the day, and this is what I told Amaleigh too, and I tell my patients, I don't live in your body. You do. I'm the translator. Tell me what you're feeling, and I will translate for you. Guys, she's not faking it. And we can objectively test that in black, white, and red, okay? And
yeah, if you look at my images, you're like...
It's there. Okay.
Why are you not screaming?
Exactly.
Like the radiologist that I went to the other day, because you took me to one, but I went to another one with producer Matt over there,
as a friend.
Yeah, as a friend. No,
I would not pick her up and take her to her appointment as her doctor, okay? So.
Well, unless you're like a traveling nurse.
Yeah,
that's not what you are.
And then that's permissible. Well, you just want to make sure that they know.
Yeah,
Don't do that.
She's not my doctor anymore.
No.
That's just everyone's clear. We're just friends now. Who she happens to know a lot about my case, and I know a lot about her, just in general. So, but when you look at my images of my shoulder, of both my hips, of my spine, the radiologist is like, and they can't say anything to you about what they see, but you feel it.
You feel it.
You feel it when someone does your MRI, and they're like, well, I hope you get better. I hope that
you're not. It's almost like it's hard to have a conversation. You're like, so what do you see? And sometimes you actually get to see the screen. You're like, oh, that looks different. What's that over there? I'm like, oh, I can't talk to you. There's phrases that the techs are instructed to give because they're not legally allowed to tell you what's on the screen.
Yeah.
So I mean, guys, it's all here. It's all here.
Yeah, but they know. But the radiologists have seen enough stuff that they know what the X-ray said. They know what that looks like.
And I know y'all are waiting.
They know.
It's more of a CYA, and it's more of a. There's a reason why
they just can't diagnose.
And it takes time, and then and then like not number 1 but number 2, and then scan. Yeah, so just know like it's there. It's there. Even if it takes them a week, the radiologist hasn't got back to me. I had that MRI a long time. I had that MRI a week ago, 2 weeks ago. Here all the time. Even if it takes them a while to get on your chart, guys, just don't sweat it. I would just say give that up and be like, when it comes because it's coming. The answer's in the image. The answer's in the image. Your body will tell the story,
but not always,
and keeps the score. But
not always.
And they have to take the right picture.
Yeah, because they didn't know for the whole time. I've had tons of dislocations before that I couldn't get back in because it wasn't done by myself. If I dislocate myself, I'm fine.
Yeah.
But when somebody else's body weight hit me or a car, or
yes,
whatever, it's a different feeling.
1, 2, yeah.
You can't put it back
1, 2,
in, right?
3,
It's not as easy. So like, they have tons of images from me from when I was a kid, and they had tons of blood work because a lot of my family has thyroid issues, so they always went with the assumption that it's probably a thyroid issue that just maybe wasn't
presented differently.
That wasn't, the ANA receptors weren't positive yet. But they're gonna
waiting on you to
but
be
they're gonna be. They're always checking me
that's
because
what they're looking at, but nothing else.
But there is no regular test that they would ever do for you at any regular doctor to test you for this gene unless you already had a family member that was diagnosed. So like once I got diagnosed, my mother, who has had 22 spinal surgeries, got diagnosed, and she has it. And that's probably why her spine deteriorated the way it did, and why she kept having refractures after she was completely fused from sacrum to C7, which is almost a brainstem, right? Like completely fused. This woman is like a bionic woman, right?
And she, this is Amaleigh's mom, and so like she can talk about the story. They've had their discussions. But
she wants to be on here. She wants to talk about it because it's insane what happened to her, and she didn't get diagnosed until I got diagnosed, and now all of my cousins can get diagnosed because my geneticist told me that. She's like, well, now that you're diagnosed, now everyone can. And you don't have to have a referral. You don't have to have nothing because I'm in there. They'll do it, and they'll give you a $50 genetic test because they know what they're testing for. But like just a broad spectrum genetic test, they're not going to test for that. No. Just a blood work test, like your blood work is normal, and I'm like, cool. My blood work is normal, but I'm not normal.
DNAancestry.com would not have given you this, right? Mm-hmm. But imagine if we added that in. Now we lost it because.
But it knows other
papers,
things. Like
right?
they'll know, like if you're like a Ashkenazi Jew, that you're more likely to have like Crohn's disease.
Yeah.
Like they know these things, but collagen disorders. I think because we really don't have all the answers genetically yet. The science isn't there yet, and there's not enough people that really care about it. Because the only people that are doctors for it, that specialize in it, have it themselves. And I think that's why I submitted my information to studies. They asked me if I wanted to, and I said, yeah, absolutely. Absolutely use my DNA. I gave them extra files. I'm like, yeah, absolutely use my DNA. I would love for y'all to figure out what's actually wrong with me and what's actually wrong with everybody else that has this. And it's not that I think the goal for medical communities is that they want to erase the gene. I don't want to erase the gene. No. I think that we're capable of inhuman things almost. Like we're almost like alien in the way that we can move our bodies is different. The way we think is different. I don't want to delete that.
Do you feel
I want to learn how to manage it from a young age to where you can live your healthy best life and you can be a super athlete and be healthy. You can run track. Right? You can do dance.
Yep.
But you can't play football. And if that's what you really want to do, then do it, but know that you have to protect every single joint, and you have to really eat all your protein, you have to really watch all your micronutrients, and it's going to cost you in the long run.
And you're going to need
may not be as present whenever you have kids, whenever you're aging, you might not be as present. You have to take that into account. Is this now worth me prematurely aging? Because the outside of my body, because my collagen is loose, looks young. The inside of my body, like I have the hips of an 80-year-old woman.
Think of the machine, guys. You can look at it in black and white. It exists in our world. Now 18-wheelers are expensive, but they go out differently. They're driven differently. They're unloaded differently. Like everything's different. The gas is different. And the more special your car is, the more that you need to take it to a specific dealership and have a certain, oh ma'am, I don't do that. I only do the tires. Oh, I don't do alignment. Oh, I only do oil changes, right? You're going to have to take this to the so-and-so, the dealership, to have this diagnosed on your car. This is no different. So hopefully we start to actually look at our bodies as the incredible machines, and it's more than that. But from the black, white, and red, if you understand the machine to the nth degree and then you know who to take it into, I can see lights turning on in the car. The check engine light, you know what that looks like. You know what the gas light looks like, right? Like the windshield wiper, you understand the weather on the outside, which is the hormones. We'll get into that another time. But how you drive your car on the inside, the specialization of your own car, how you drive the car matters, how you drive the car costs. And don't get mad at the car. And you guys you've heard this analogy. Don't get mad at the car because you took it to California and back, or halfway across the nation. We say California. We drive 13 hours in Texas and we're still in the same spot, right?
So California is, from Texas to California, is half of our country.
It takes over 2 days
Yeah.
to drive it. Like, I mean, if you want to drive it, if you want to take it, and not only is the terrain different, the weather's different, you want to go there and back. One, how much you drive that car depends on, like, how you drive it to California and back, how fast you drive it. And you're gonna probably have to do the oil change, check on the tires. Hope you don't get a nail or hit something on the way there too. Okay, the longer you drive, and statistics will show, the longer that you drive and how you drive your car matters. How you drive your car matters. The weather that you hit on the way there, the cold weather versus the warm weather. You could have the same car in different environments. I mean, guys,
And they act different.
They act different.
And
That's
your human body is no different. Your body is a machine as well as a spiritual being, but it is a machine. And unfortunately for people like me, we have to treat it like a machine. And I think athletes are taught that. But the problem is they're not taught the connectivity emotionally. They're not taught how to deal with pain. Right? I don't know if you experience this, but I think most people that are athletes experience you just push past the pain. And you push past it. I can't tell you how many times I've come across gymnastics coaches and ballet teachers that I've experienced this, other people have experienced this, people have gotten sued over this, that they, you're doing the butterfly, right? And I'm like, oh, my hamstrings are tight, and they just force.
No.
They just force your legs down. Like, we know that you can do it. They force you. Right?
No.
Exactly. But that happens all the time. And then you are taught in that world, because I don't know if you ever did gymnastics or dance, but
I did gymnastics, but no one ever forced me into a position like that.
Yeah, that's like a crime. There have been people that have been sued over that because they've like totally popped somebody's hamstring, and that's that is a life-ending, like, I'm not talking about life as in like you're gonna flatline. I'm talking like you cannot do gymnastics ever again. If you can't if you pop a hamstring, you're done.
Well, and then you can't undo that. That tissue.
You will never walk the same again. You'll never do anything the same.
If your
hamstring is snapped, you literally can't do anything. Right?
You have to have surgery for it. Like, guys, this is huge. It's not okay.
Yeah.
And for someone who will survive that, who survives that snap that's not supposed to ever happen, the stretchy, right? The Ferrari can survive that.
I can survive it with great difficulty, but there are people who I have seen who parents have sued gym coaches for doing that because they have popped somebody's hamstring doing that. No. And their 8-year-old child will most likely not ever walk the same ever again.
No, because now you've changed the car, right? That's no different than me saying
they might have to go to their
what if I took and I dented the it's okay, it still drives the same, right?
No.
If I hit your front,
it's not
right.
No. If you pop a hamstring, you pop a bicep. It's not even that you have a dent in the hood, dude. It is literally like you broke the axle of the car. The car is total
shift. It's gonna walk differently. Now I will say that
I've seen some incredible recoveries.
Yeah, but we're not that fragile. But at the same time, that system, you have changed it, right? If you remodel the inside of the car from leather to whatever. That car was made a certain way.
Yeah.
It showed up a certain way on the lot, out of the factory. You changing the seats manually after the fact, after it gets off the line, has now forever changed that car. You can't go back to it, right? Mm-hmm. Even if I paint a room, if we repaint this room white, I can't undo the green underneath, and I can't undo the color that it was before, and the texturing that it was before. I mean, all of that matters. So, like, I can change the color of the room, but again, there's 3 layers of paint, you know what I'm saying? Or however many layers of paint. So it might look different, it might look the same, but the walls are different. So you're right, like, we're not that broken, but at the same time, we're resilient. And we have to acknowledge that there was a change and it's different, and how do we move forward with that?
Well, and if that parent can't afford, right, I just think about this case constantly, I'm like, that happened to me too. And it personally affects me because I'm just like, that's disgusting to do to a child.
Yeah.
To force them, and there's a video of that case that I'm thinking of, that they're forcing her, because they had to use the video footage and
probably need to add it to the list.
She was screaming, and like, no, someone is telling you no, they can't do it, so don't make them do it, right? And that happened to me, and it happens to a lot of gymnasts. It happens to a lot of dancers that happens to. They just use all. I don't believe in having somebody else stretch you. Also, I know there are these classes where people are stretching you. I don't believe in other people stretching you.
Really, really bad, guys.
You know your limit. The other person doesn't know when you're about to snap. So I don't suggest going to one of the stretch bar places. I think that's weird.
So you want to create chaos and havoc in the nervous system is
Yeah.
you give it something that it can't control. Who would like that? Like, who would like a car that they sit in and they want to go north and it goes south?
I don't know, but people like it.
No, it's like,
I've seen videos where people really like other people stretching them, and I'm like,
well, it's unsafe, and they get away with it maybe because they're an 18-wheeler, right? And that might be okay for an 18-wheeler, but then from a PT standpoint, I would still say it's not good.
The thing is that, so the thing is that
good.
when I've had other people stretch me, for like massages or whatever, right? They want to hold your arm, right? They want to hold it and they want to kind of pull on it. They're like, it takes a lot for them to feel the stretch, right? Because you can feel whenever, like, if I grab you,
in range,
right?
This is standard. What she's talking about, guys.
You can feel, okay, that's tight right there. So we're gonna stretch it a little bit and then we're gonna let
Keeps
go.
Going.
But mine, right, and yours kind of does too. But mine keeps going, and so they're like really trying to get that same. I'm like, no, you're still stretching my ligaments. You're still stretching my muscles. You don't have to actually pull me all the way out, because if you do, it'll come out. Like, you don't have to actually try that hard.
Caution to my brothers and sisters.
I have
in
the
chiro.
same. Yeah, I have the same muscle tissue as you, right? I'm built a little bit differently, but I'm still the same anatomy-wise, human-wise. Like, because you can pull it all the way out doesn't mean that you should. To get that stretch, you're still giving me a stretch. It just may not feel like it. And that's why I don't trust them doing it. And I have to tell masseuses, do not afterwards. And I don't go to chiropractors at all. I don't believe in them.
And for an 18-wheeler,
that's what broke my mom's back.
Right.
Because they don't know. They're used to feeling, okay, this is tight. So they're like, oh, well, you're really flexible, so let's just go as far as I can to where I feel the resistance. It's like, well, if you don't ever feel that resistance until it's broken, what are you going to do?
And I think we go back to the ones who I have trusted in long term, and the only type of chiropractor and I have good relationships with them, because they do exist, guys, just because they're not looking maybe for a cavitation, but a grade. We literally have grades 0, 1, 2, 3, 4, 5. Right, like we can grade them objectively, and a lot of times they have sounds to them too. Like an older crack sounds different than a new crack, and different vertebrae, because the joints are made differently. They make different sounds, like a piano keyboard. So we feel and hear what Amaleigh's talking about, and that's where my fellowship comes in, is that chiropractic, osteopathic.
Yeah, and I know once you found out what I had, you were scared to crack me.
Exactly, and I was like, oh my gosh, because I feel, and it's not my job, but hopefully we have that conversation easier. I feel the difference of, it's not gonna crack, and what I tell her, and without somebody who has the diagnosis, I'll say, your body will tell us whether or not she wants to be cracked. We will know. She either will go or she won't. We will find this
but
range, and there's certain parts that I wouldn't crack her on. I mean, headaches. There's huge red flags that I'll get into later, guys, because it's that. I think that's big for them to know too.
I think you'd have to write. I think we'd have to really.
I can add in a PDF, like literally where they can go like, what are the red flags of where maybe I shouldn't be popped, or maybe it's a conversation, or if I feel this, I need to only go to a chiropractor who is educated and aware with this lens, right? So we'll give you guys
my dad's chiropractor down in Yorktown, Texas, helped me after one of my wrecks with my neck, and he spent a lot of time, like the whole appointment. I was like over an hour of just massaging and getting traction on my neck before he ever moved it. He was like, it's like to move your muscles right now, it's like trying to bend like, what did he say, a copper wire, but not one wire. He's talking about like the train wires, right? He's like, it's like that. It's like trying to massage that out. And he spent so long just trying to get my whole spine to relax before he ever did just one thing on my neck. Just one crack on my neck. And I was like, oh, fabulous. But he knew what to do with my body because he had seen my father, who has EDS, and my grandmother. And it shows up differently. And he was old. And so he had seen all of us already. He had already seen my genetic lines, like, yeah, you all got this thing. He didn't know what it was, because he's a small town doctor. Population 2,000, like, he doesn't know, but, like, he knew in his mind.
You differently.
So that's the only one that I've ever gone to that I believe in, because some of them I feel like are snake oil salesmen, to be honest with you.
He listened to your body.
Some of them, not all chiropractors,
right.
but some of them are snake oil salesmen.
Good and bad of everything, right? Shadow light. Where's the philosopher in the room?
Yeah, you know, like, the person that broke my mom's back, not a good person. And that's why they lost their license over it. Like, you're not a good person. You should not force somebody into end range just because you think that they can. I think that's what people need to understand.
I trust, at the end of the day, my take home for students, patients, humanity alike, I trust you. And I think that's even on a friend level. Like, I trust you. Like, when I look at Amaleigh as a friend, I'm like, Amaleigh, I trust you to make the best decision for you. Will I be honest about what I see from the outside? Yes. Will it be hard to hear sometimes? Yes. Will I want to cheer you up and be like, hey, we don't have to talk about X, Y, or Z, but we can still move on? Yes, right? So my intent is for Amaleigh to thrive and survive, not just survive, but to thrive, and that's what I see all patients as. And I think that's who we also magnetize to be around each other, is like, I want to be around people who want me to win. And we talk about women entrepreneurs, like women supporting women, and that doesn't take away from the masculine supporting the masculine. It's just like, I see you, right? In the sisterhood, my machine is very, very similar to yours, because my hormones hit differently on the moon phase, hopefully, if I'm regulated, as whereas a man might go through the same hormone cycle but within a year. And that's when we get into hormone specialists, guys. So I'm not speaking on this from a medical side. But all that to be said, that I trust Amaleigh taking care of Amaleigh on all the levels. And I know that my people trust me to take care of me at the end of the day. And I might have a bad day, I might be upset, I might have a migraine one day, right? Like, we might have different moods, and that's okay too. But I trust, and I think at the end of the day, I trust me to take care of me.
Yeah. And I think a lot, to close out, what I'll say is,
wake up. Snooze.
I'm not saying you need to research and think that you have brain cancer.
Yeah, don't.
But I'm saying that be aware of your body, listen to your body. If your doctor isn't listening to your body, get a new one. You are allowed to. They make you feel like you can't. You're allowed to get a new doctor. And if anybody ever says you're doctor shopping, fuck them. You will find a doctor that listens to you if you are having any type of medical issue, any type of chronic illness, like that this isn't going away, right? I got COVID and I'm not better. Like, these type of things exist, and you need to listen to your body. I'm not saying watch Grey's Anatomy, think you have all these rare things, because most of the time it isn't going to be the zebra. But believe your body. Don't let someone tell you that you're wrong about your body, because the doctor doesn't live in your body. They don't live in your body. They don't know what's normal and what's abnormal for you. Don't just listen because they're saying, oh, well, your chart's normal, your blood work's normal. Okay, but did you do the full panel? No, you didn't. Oh, you did was a CBC diff, right? Like, you didn't really look. Mm-hmm. So trust your body, know your limitations. Don't let a personal trainer, a doctor, a physical therapist, a chiropractor, a masseuse, anybody touch you in a way that you feel is uncomfortable, and continue to allow it. You have the say, you have control over your body. Make sure that you are giving your body proper nutrition, and it's not always going to be some new fad diet that they're pointing out. It's going to be, you have to look at it and eat this one. You're going to have to eat chicken one day, like, and then go through the whole 24-hour period, 48-hour period that it takes to digest it. Did that feel good? Okay. Does rice feel good? Rice feels good. Okay, quinoa feels good. Kale feels good. This doesn't really make me feel good. Listen to that. Don't listen to what they're saying, like, oh, the carnivore diet or the vegan diet, whatever. Like, no, we are all omnivores. Talking about this earlier today. We're all omnivores, and you have to find on what spectrum you are of omnivores. And then we can get into how that genetically links to what you should be eating based off of what your genetics are. Like, the majority of people are lactose intolerant. I don't know if anybody told you this. It's not a defect to be lactose intolerant. 80% of people are lactose intolerant. 80%. Why? Because we came from regions genetically that did not drink cow's milk. Native Americans didn't drink cow's milk, right? I'm Native, I'm Scottish, I'm Irish, and I'm German. We didn't drink cow's milk. That's Dutch, right? That's Dutch people. So if you're not Dutch, you have a Dutch background, you probably can't drink milk. That's not a defect. You need to learn. If you can't, I can't eat it. And if it's worth it to you to be sick for a week because you ate milk. Well, that's how long it really takes to get everything out, right? And you're absorbing all of that into every single cell of your body. You're creating bad energy is what I think about it. Like, you get energy from food.
If you're not working out, it stays in there longer.
Exactly. So if you have higher fat content, then then everything is staying in. No water. You're not actually pushing all that out. So you have to find out what you can't eat, what works for you. Mm-hmm. You have to figure out what exercise program works for you. Some people can do the contact sports. Some people can do martial arts and it feels good for them. Some people can't. And that's okay too. Find what works for you. If all you do is walk for 2 miles a day, okay, that's all you do.
Right.
Do something that's active with yourself. Make sure you're listening to your body, and that is really, really important. And make sure that you find people that listen to you as well. Because to be heard and to be seen in the medical community is sometimes really, really hard. Yes. And don't go to the ER thinking they're going to diagnose you with some disease. They can't. So, you have to get with regular doctors you see all the time for them to ever catch anything. I learned that the hard way. Like, the ER can't diagnose me. Yeah. That was the worst place that I was going because they can't help.
Everything that Amaleigh has said, I want every single human who feels this message, what she's talking about, you can do inside your mind. And we actually did a study on this. I don't know if I told you this one. I think I told you this when you were sick. And I tell my patients this too because this fascinates me. Your mind is so powerful. Mm-hmm. Your mind is so powerful. So even if you do not have contact with the rest of your body for whatever reason, if a limb is gone, if it was traumatically removed or surgically, or you were born without it, those neurons and nerves, like as you move energetically, there's a phantom limb syndrome. We can get into all of that, but all that being said, even if you have a spinal cord injury, everything that Amaleigh talked about today still applies to you in my mind, because you can go there mentally. These learned behaviors and movement patterns, we actually activate a certain area of our brain and it lights up differently, just like it's beautiful the way the brain lights up. It's one of my favorite pictures. And it goes everywhere. It's like a firework, but one of the most beautiful things. And your firework is different than everyone else's fireworks. So all that being said, if you are wheelchair bound, if you are special needs, or I would just love to say uniquely gifted. I wish we could change the terminology. Because special needs is like, their genetics is different, right? And so anyway, and that also holds a very, very special place in my heart. But if you're wheelchair bound, if you cannot hear, and that changes how you interact with the world, so your brain is different, and great, and it's beautiful, and it's different. So we need to learn from you. So even if you cannot move your body, you can still go there in your mind. You can go there with your eyes. So even if you are not speaking, you can still go there in your mind. And there's an unfortunate phenomenon. It's called locked-in syndrome. You can still, and Parkinson's, right? There's neuro presentations that are unfortunate, and I just want the Parkinson's community to know, the Alzheimer's, like all of these different communities, we see you, right? Like, even though you're trapped and you can't communicate with us the way you used to, I know you're in there. I know you're in there. So I don't need you to go run across the field. Go there in your mind. Go there in your mind. Be big. And actually the most beautiful, and we'll have to come back to it, one of my biggest passions is Parkinson's. And that was from my neuro background in college and PT. I mean, guys, this is one of my loves. The way that you, from a PT standpoint, I'm not going to change the brain, right? I'm not getting on the chemical level. And so we thought we can actually change how the brain presents if I go a different route, and I ask you to think about movement differently. I don't tell you to raise your arm. I ask you to reach for the stars, or ask you to be a branch of a tree as the wind's blowing. I have to literally have a painting in my mind. So the more creative you are, I have to give you the right cue to ask you to do that. Or can you ask that of yourself? Can you ask yourself to be bigger? Ask yourself to be louder. What you feel on your face, you might be feeling like a 0 to 10. I feel like I'm talking at a 5. But for Parkinson's, locked in, right? Parkinson's, it sounds like this. It's much smaller. Everything gets smaller. So if you can combat that within yourself and think big, think loud, and literally there's a whole specialty within PT called big and loud. If you can think big, if you can think loud and express yourself more, like we're as therapists taught to be bigger. I'm like, can you match me, right? And you see a session within an hour of being with someone, you're asking them to be bigger and asking them to be more. Their movement for a neurodegenerative disorder got better.
Mm-hmm. Well, yeah, and the creative side of the brain goes the last, right? So people with Alzheimer's can remember how to play the piano, but they don't remember their own name. And that tells a lot about your brain and how it works. And so your imagination, imagine this. Imagine you're locked in to being a dementia patient or Alzheimer's or Parkinson's, and your creative mind is still going, but you don't have an outlet for that. So, and that's crazy to think about. and my grandparents, one had Alzheimer's, one had dementia, and to see them and like know that they're still in there, and so you have to get them to think outside of what they're like. They're maybe really really mad, but all you have to do is just play their favorite song.
Or maybe they want their favorite song. They don't know how to communicate.
They don't know how to communicate. Play their favorite song.
Autism.
Cook them their favorite food, right? Tell them that you want them to create this art thing, and they'll do it, right? Tell them you want them to read this book. Hand them a book, or hand them an activity like folding towels. Have you ever seen this? Have you ever worked in an old folks' home? Yeah,
that makes sense.
You give them an activity to do that they know how to do. They're fully capable. You're diminishing people's capabilities by thinking they can't do it. Like they can do it. So what you do if a patient is really frustrated, right? They're in the old folks' home, right? And they are really upset and getting kind of angsty and whatever. All you have to do is just say, "Hey, help me fold these.
Oh.
Help me fold these towels." You come in there, you mess up the towels. The nurses mess up the towels, and they say, "Here, fold this for me," and they'll do it.
Wow.
And their brains automatically, all of a sudden, they're moving their hands more than they could earlier. They're able to move their bodies more than what they could earlier because they're given a task that you're telling them they can do.
Yeah.
Because they don't know that they can do that anymore.
Yeah.
But you're telling them, "You can fold these. Can you help me with this?" And they do it.
I love it.
They do it. "Hey, do you want to play the piano? Do you want to read this? This is your favorite book. Do you want to read it?" And they're like, "Yeah." And so you need to find people that can see you, that know you, that understand what you're going through. And you need to find your people that, as far as doctors and specialists that believe you. And I mean, if you're just a regular patient, you're just going to the doctor for a UTI, you better make sure that you're writing down all the things that are going on with you before you get there. If you're likely to forget them in the chaos, or you're anxious about the doctors because maybe you have a bad experience with the doctor, like I did, right?
Or it's your norm.
Yeah, like you have to kind of write it down. You have to kind of defend yourself, unfortunately, especially if you're a woman. And that's women's healthcare is a whole other topic they'll have to get into. Obviously, men get treated certain ways too, but we know everyone knows at this point that
We're genetically different. We're
women's healthcare is different, and they don't test anything on us. I think if you don't know that about the medical community, you're really far behind. They don't test any of the drugs on women that they do on men. Like they don't do as much testing on women as they do on men for anything. And I think it's because they're scared. Probably because they're scared about what if they give you an experimental drug, what it'll do to your ovaries. I don't know.
We definitely have those contacts though, so we'll get you guys, and we'll have guests on the show too, so they can speak for the like-minded clinicians who are in that field over video. So
okay, so don't be afraid to be loud and proud.
Please be big, be loud.
Be big, be loud,
yeah.
And if the doctor's scared of you, we'll find a new one.
That's okay. It's like dating.
And if you don't feel comfortable with something, don't do it.
Don't do it. It's okay.
Period. End of story. The world is not going to end if you don't do a certain stretch.
What's that saying? Like, what is meant for me will find me. And there's a phrase like that. There's nothing I can do to mess up what's for me, and anything that's not for me shall pass.
Yeah.
Like, guys, just go to the doctor. You'll know whether or not it's comfortable, even those with spinal cord injuries, even if you can't feel something, you know the presence of that doctor or clinician or person in the room, you know whether or not within, if you're comfortable with that. Hopefully you can communicate that in a safe space. That we'll get to that another time. But just know that, you'll feel whether or not this is a good fit.
And listen to it. I believe that you should listen to your intuition more. I think in modern day society we're taught not to listen to our intuition. You should listen to it more. I wish I did. So that's going to conclude that. Listen to yourself.
And if you drive the Ferrari halfway across the country and you've made that decision like Amaleigh made today, hey, this is worth this to me. What is she going to do afterwards to take care of herself? And we'll probably have to cover that another time, because there's a way that you take care of a Ferrari differently after she's been on a long journey. So
yeah. So we'll get into that later. But thank you guys for stopping by. We hope that you enjoyed this long ramble session. Mm-hmm. But that concludes today. Thank you for being here. We really appreciate it.
Hey, and for the marathon runners who are still here, wow.
And even if y'all don't listen to it, we did it for us. That's at the end of the day.
That's the healing part. That's this room.
At the end of the day, even if it doesn't reach anybody, if it reaches one person.
If it reaches one person
like me, I'd love it.
Love it.
I would love it. I'd be so happy.
Cheers to the producer. Thanks for being in the same. Yes, thank you. Our crew is so cool. Can't wait to feed us good food.
I don't think he cares about food right now. He's so tired.
Oh.
I can tell he's tired. I've been looking at him this whole time. I've been looking down over here.
He's like,
Giving an encouraging smile. It's producer Matt, who's back behind the camera, like falling asleep.
Yeah.
So I don't know how he can fall asleep with the headphones in listening to our audio right now, but he can. So, alright. So we will catch y'all on the next one. Pew, 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 pew. Bye.
Good luck, guys.